NCLEX PN Archer Review Part 4. Question 1. Which of the following members of the interdisciplinary team should be consulted for an infant suspected of having celiac disease? Here are the options. Option A. Pharmacist. Option B. Pulmonologist. Option C. Occupational therapist. Option D. Dietitian. The correct answer is option D. Dietitian. Correct answer, dietitian. Consulting with a dietitian is of the utmost importance for the patient who is suspected of having celiac disease. The dietitian is the expert in this area and will provide support, education, and a dietary plan for this patient. Learning to avoid gluten can be difficult for the family, and the dietitian is the best resource to help them navigate this. Question 2. A client with a history of congestive heart failure is admitted with acute exacerbation. While collecting data on the client's vital signs which finding would indicate a potential complication of heart failure, here are the options. Option A. Decrease in blood pressure. Option B. Increase in temperature. Option C. Decrease in respiratory rate. Option D. Increase in blood pressure. The correct answer is option A. Decrease in blood pressure. Correct answer. Decrease in blood pressure. Congestive heart failure (CHF) is characterized by the heart's inability to pump sufficient blood to meet the body's demands. It can result in fluid overload and increased pressure in the blood vessels. A potential complication in a client with CHF is decreased cardiac output, which can lead to decreased blood pressure. Initially, the blood pressure may increase. However, a complication is decompensation, which may cause the compensatory mechanisms to fail. Question 3. The nurse recognizes which of the following anticholinergics is appropriate for a client diagnosed with urinary bladder urgency and incontinence? Here are the options. Option A. Dicyclomine. Option B. Ipratropium. Option C. Oxybutynin. Option D. Scopolamine. The correct answer is option C. Oxybutynin. Correct answer, oxybutynin. Dicyclomine is used to treat irritable bowel syndrome. Oxybutynin is an anticholinergic drug. It is used to treat urinary bladder urgency and incontinence. It works as a bladder relaxant and has 10 times more potent antispasmodic effect than atropine. Anticholinergics are drugs that have actions opposite those of the parasympathetic branch. Their work mimics the fight-or-flight response. Question 4. The nurse is obtaining vital signs for a client who has acquired immune deficiency syndrome (AIDS). Prior to entering the room, the nurse should do which of the following? Here are the options. Option A. Wear gloves and a gown. Option B. Perform hand hygiene. Option C. Review the client's viral load. Option D. Obtain a disposable stethoscope. The correct answer is option B. Perform hand hygiene. Correct answer. Perform hand hygiene. When caring for a client who has AIDS, the nurse should maintain standard precautions. Applying PPE such as a gown, pair of gloves, and mask would be inappropriate. Standard precautions require appropriate hand hygiene and other PPE as needed. Question 5. The nurse is caring for the following assigned clients. The nurse should initially follow up with the client who. Here are the options. Option A is repeatedly washing their hands. Option B, talking over others during group therapy. Option C, yelling and shouting at others. Option D is voluntarily admitted and requesting discharge. The correct answer is option C, yelling and shouting at others. Correct answer, yelling and shouting at others. The client yelling and shouting at other clients requires immediate intervention because this situation is hostile and warrants the nurse to de-escalate the situation before it intensifies. Question 6. The licensed practical/vocational nurse LPN/VN is caring for a client with a tracheostomy. Which of the following items is essential to have at the bedside? Here are the options. Option A, air humidifier. Option B, inner cannula. Option C, nasal cannula oxygen. Option D, tracheostomy brush. The correct answer is option B, inner cannula. Correct answer, inner cannula. An inner cannula of the tracheostomy size and one smaller is necessary to keep at the bedside. This is essential in case the inner cannula becomes dislodged. Question 7. The nurse is observing a student nurse feed a client requiring aspiration precautions. The nurse should intervene if the student. Here are the options. Option A asks the client to remain sitting upright for at least 30 to 60 minutes after a meal. Option B reminds the client to tilt their head backward when eating and drinking. Option C avoids mixing foods of different textures in the same mouthful. Option D places salt and pepper on the client's food at their request. The correct answer is option B, reminds the client to tilt their head backward when eating and drinking. Correct answer, reminds the client to tilt their head backward when eating and drinking. This action by the student nurse requires intervention. The client should assume the chin-down position and be reminded not to tilt backward when eating or drinking. The client should be instructed to have their head turned and chin tucked to reduce the risk of aspiration. Reminding the client to tilt their head backward would increase their risk for aspiration. Question 8. The nurse is teaching a client about newly prescribed insulin glargine. The nurse recognizes the need for further instruction when the client makes the following statement. Select all that apply. Choices. I will take this insulin right before my meals. I should roll this vial of insulin before removing it with the syringe. This insulin will help control my glucose for 24 hours. I can only inject this insulin into my abdomen. I'm glad to know I can mix this with my regular insulin. Here are the options. Option A. I will take this insulin right before my meals. I should roll this vial of insulin before removing it with the syringe. I can only inject this insulin into my abdomen. The correct answer is option A. I will take this insulin right before my meals. I should roll this vial of insulin before removing it with the syringe. I can only inject this insulin into my abdomen. Correct answer. I will take this insulin right before my meals. I should roll this vial of insulin before removing it with the syringe. I can only inject this insulin into my abdomen. Question 9. The nurse assists a registered nurse in developing a care plan for a client with psychosis associated with schizophrenia. Which of the following interventions would be appropriate? Here are the options. Option A. Provide therapeutic touch. Option B. Set limits on splitting behavior. Option C. Establish a trusting, non-threatening relationship. Option D. Immediately restrain the client for verbal aggression. The correct answer is option C. Establish a trusting, non-threatening relationship. Correct answer. Establish a trusting, non-threatening relationship. The most crucial goal for a person with schizophrenia is establishing a trusting relationship. This therapeutic rapport may help clients decrease their paranoia, which is commonly found in individuals with schizophrenia. Question 10. The nurses discussion healthcare-associated infections with a group of students. The nurse understand that which of the following actions is most effective at reducing the incidence of healthcare-associated infections? Here are the options. Option A. Screen all newly admitted clients for colonization or infection with MRSA. Option B. Develop policies that automatically start antibiotic therapy for clients colonized by multi-drug resistant organisms. Option C. Ensure that dispensers for alcohol-based hand rubs are readily available in all client care areas of the hospital. Option D. Require nursing staff to don gowns to change wound dressings for all clients. The correct answer is option C. Ensure that dispensers for alcohol-based hand rubs are readily available in all client care areas of the hospital. Correct answer. Ensure that dispensers for alcohol-based hand rubs are readily available in all client care areas of the hospital. Since healthcare workers' hands are the most common means of transmission of infection from one client to another, the most effective method of preventing disease spread is to make supplies for hand hygiene readily available for staff to use. Reducing the risk of healthcare-associated infections is the responsibility of every healthcare worker. Following standard precautions for all clients is the easiest and most effective way of preventing disease spread. Question 11. The LPN is caring for an infant who will be going to the operating room the next day for surgical repair of his total anomalous pulmonary venous return. She has finished signing the consent paperwork for the operation. The mother states, "I'm not so sure about this. What if my baby dies?" What is the appropriate action for the LPN? Here are the options. Option A. Explain the procedure to the mother. Option B. Notify the surgical team and have them come back to speak with the mother. Option C. Reassure the mother that everything will go as planned. Option D. Tell the mother that because she has already signed the consent paperwork, she cannot change her mind now. The correct answer is option B. Notify the surgical team and have them come back to speak with the mother. Correct answer. Notify the surgical team and have them come back to speak with the mother. The LPN has identified that the mother has concerns about the surgery, so it is her responsibility to notify the surgical team and have them come back to speak with the mother. Question 12. Which of the following is the most appropriate position for a client getting a thoracentesis? Here are the options. Option A. Sitting up, leaning over a bedside table and feet supported on the ground or stool. Option B. The head of the bed flat, with the client lying on the unaffected side. Option C. Prone with both arms extended above the head. Option D. With the head of the bed elevated 45 degrees and the client lying on the affected side. The correct answer is option A. Sitting up, leaning over a bedside table and feet supported on the ground or stool. Correct answer. Sitting up, leaning over a bedside table and feet supported on the ground or stool. The client should be sitting up, leaning over a bedside table with arms rested and feet supported on the ground or stool so the needle can be inserted appropriately. Usually, only sufficient fluid to lubricate the pleura is present in the pleural cavity. However, excessive fluid can accumulate as a result of injury, infection, or other pathology. In such a case or with pneumothorax, a primary care provider may perform to remove the excess fluid or air to ease breathing is also performed to introduce intrapleural chemotherapeutic drugs. Question 13. The nurse cares for a client with polycystic kidney disease (PKD). Which of the following would indicate the client is achieving treatment goals? Here are the options. Option A. Blood pressure 128/63 mmHg. Option B. Creatinine 2.3 mg/dl. Option C. Proteinuria. Option D. Sodium 132 mg/L. The correct answer is option A. Blood pressure 128/63 mmHg. Correct answer. Blood pressure 128/63 mmHg. Treatment goals for a client with polycystic kidney disease (PKD) include maintaining normotension, the glomerular filtration rate (GFR), and the prevention of sodium wasting, which is evidence of a decline in renal function. Hypertension is a cardinal finding in PKD, and if a client is achieving the treatment goals, they will maintain regulated blood pressure. Question 14. The nurse is data collecting on a client with congestive heart failure. Which physical finding should the nurse expect? Here are the options. Option A. Intermittent claudication. Option B. S3 gallop. Option C. Venous stasis ulcers. Option D. Widened pulse pressure. The correct answer is option B. S3 gallop. Correct answer, S3 gallop. An S3 gallop is an expected finding in heart failure. This is often an early manifestation of heart failure. It and this sound are best auscultated at the apex of the heart. Question 15. The nurse is helping the unlicensed assistive personnel pass meal trays. When providing a meal tray for a client diagnosed with pheochromocytoma, which dietary item should the nurse remove? Here are the options. Option A. Macaroni and cheddar cheese. Option B. Watermelon slices. Option C. Caffeine-free cola. Option D. Baked chicken. The correct answer is option A. Macaroni and cheddar cheese. Correct answer, macaroni and cheddar cheese. Pheochromocytoma is caused by a tumor on top of the adrenal medulla, causing a surge in catecholamines to be released, thus causing the client to experience headaches, hypertension, hyperglycemia, tremor, and unintentional weight loss. A client with pheochromocytoma is advised to modify their diet so that it does not increase blood pressure. Cheddar cheese contains thiamine and should not be included in the client's diet. Other dietary modifications include limitations of caffeinated beverages, which may also raise blood pressure. Question 16. The nurse is instructing a client on deep breathing and coughing. The client asks the nurse, "Why is it best for me to be sitting for these?" What response would be best for the nurse to provide? Here are the options. Option A. It is physically more comfortable for the client. Option B. It helps the client to support their positioning with a pillow. Option C. It loosens respiratory secretions. Option D. It allows the client to observe the room and relax. The correct answer is option B. It helps the client to support their positioning with a pillow. Correct answer. It helps the client to support their positioning with a pillow. The client should be sitting when deep breathing and coughing. This position allows the client to use a pillow, providing abdominal support when coughing. It also allows the lungs to expand more fully and the diaphragm to drop. Coughing and deep breathing exercises are essential to enhance lung expansion and mobilize secretions, thereby preventing atelectasis, collapse of the alveoli, and pneumonia. Question 17. The nurse from an adult-only unit has been pulled to a floor that has clients of all ages. What would be an appropriate action for this nurse? Here are the options. Option A. Accept the assignment, but ask to be paired with a more experienced LPN. Option B. Accept the assignment, but explain the situation to the charge nurse and ask for a quick orientation before starting. Option C. Take the assignment, but tell the charge nurse she will only care for adult clients. Option D. Refuse to take the assignment, as caring for the infant and child population is not within her practice scope. The correct answer is option B. Accept the assignment, but explain the situation to the charge nurse and ask for a quick orientation before starting. Correct answer. Accept the assignment, but explain the situation to the charge nurse and ask for a quick orientation before starting. The nurse should take the assignment, but explain the situation to the charge nurse and ask for a quick orientation before starting. While the LPN may specialize in a specific type of nursing or feel more comfortable caring for a particular client population, she should be able to use her skill set to safely and independently care for other people as well. However, the LPN should let the charge nurse know her background before beginning her shift to familiarize herself with new equipment, ask questions, and identify resources. Question 18. The nurse is changing a diaper for her 7-month-old client suspected of having celiac disease. She notes a large, pale, oily stool that is malodorous. The nurse knows this assessment finding is known as what? Here are the options. Option A. Diarrhea. Option B. Steatorrhea. Option C. Hematuria. Option D. Melena. The correct answer is option B. Steatorrhea. Correct answer, steatorrhea. Steatorrhea refers to the expression of abnormal quantities of fecal fat due to reduced fat absorption by the intestines. This produces pale, oily, malodorous stools and is a symptom of celiac disease. Question 19. The nurse is discussing the prevention of constipation with a pregnant client. What intervention is the most appropriate for the nurse to provide? Here are the options. Option A. Increasing the consumption of fruits and vegetables. Option B. Taking a mild over-the-counter laxative. Option C. Lying flat on the back when sleeping. Option D. Reduce consumption of iron by half the amount. The correct answer is option A. Increasing the consumption of fruits and vegetables. Correct answer, increasing the consumption of fruits and vegetables. Dietary roughage or fiber with sufficient fluids and exercise may help relieve constipation. Constipation in pregnant women is thought to occur due to hormones that relax the intestinal muscle and by the pressure of the expanding uterus on the intestines. Relaxation of the abdominal muscle causes food and waste to move slower through your system. Sometimes iron tablets may contribute to constipation. Question 20. The nurse is observing the surgical aseptic technique of a nursing student. Which observation by the nurse requires follow-up? Here are the options. Option A. Spills sterile water onto the sterile field. Option B. Uses sterile gloves to handle objects on the sterile field. Option C. Has sterile gauze placed into the sterile field. Option D. Keeps the sterile field above their waist. The correct answer is option A. Spills sterile water onto the sterile field. Correct answer. Spills sterile water onto the sterile field. When a sterile surface comes in contact with a liquid, the sterile object or field becomes contaminated. Even though the spilled water is sterile, it creates and may disrupt the sterile protective barrier. The nurse should intervene because microorganisms travel to the sterile object if moisture leaks through the protective covering of a sterile package. This observation requires follow-up because the sterile field needs to be discarded and re-established. Question 21. The nurse is caring for a client who recently had a cast placed on their right lower extremity. Which of the following statements by the client would be the most alarming to the nurse? Here are the options. Option A. I've been having pain in my right calf. Option B. My right leg feels really itchy. Option C. I didn't keep my leg elevated as the doctor asked me to. Option D. When I put weight on my crutches, it makes arthritis in my wrists worse. The correct answer is option A. I've been having pain in my right calf. Correct answer. I've been having pain in my right calf. Pain in the casted extremity could indicate neurovascular compromise. Clients who have been in a cast should be educated on safety measures and signs of complications before discharge from care. It is not uncommon for the skin inside a cast to itch. However, any signs of neurovascular compromise should be immediately reported. If a client reports pain in a casted extremity, this is a sign of compromise and requires immediate assessment/intervention. Clients should be instructed to report pain, tingling, or edema in the extremity that is greater than before the cast was applied or if the cast feels too loose. Question 22. Which of the following clients is at greatest risk for impaired vascular perfusion? Here are the options. Option A. An 80-year-old female with a history of alcoholism. Option B. A 75-year-old male with a history of radon gas exposure. Option C. A 59-year-old male with a history of cigarette smoking. Option D. A 60-year-old male with a diagnosis of hypertension. The correct answer is option D. A 60-year-old male with a diagnosis of hypertension. Correct answer. A 60-year-old male with a diagnosis of hypertension. Many conditions can disrupt the exchange of oxygen and carbon dioxide. Still, diabetes, obesity, anemia, high blood pressure, and coronary artery disease are some of the more common risk factors that can cause ineffective tissue perfusion. Other risk factors include immobility, hypoxia, decreased cardiac output, diabetes, and hypoventilation. Question 23. He nurse is caring for a client who is receiving prescribed methylargonavine. Which of the following findings would indicate a therapeutic response? Here are the options. Option A. Increased blood pressure. Option B. Decreased postpartum bleeding. Option C. Decreased uterine tone. Option D. Increased urinary output. The correct answer is option B. Decreased postpartum bleeding. Correct answer. Decreased postpartum bleeding. Methylargonavine is an alkaloid medication used to manage postpartum hemorrhage PPH. This medication causes vasoconstriction, therefore decreasing postpartum bleeding. Question 24. The nurse is caring for a child experiencing anaphylactic shock. The nurse should prioritize administering. Here are the options. Option A. Nasal cannula oxygen. Option B. Intramuscular IM epinephrine. Option C. Intravenous Roman 4-dexamethasone. Option D. Intravenous Roman 4-diphenhydramine. The correct answer is option B, intramuscular IM epinephrine. Correct answer, intramuscular IM epinephrine. Anaphylactic shock is a life-threatening allergic reaction that can lead to rapid and severe airway constriction, hypotension, and other systemic symptoms. The first-line treatment of anaphylactic shock is IM epinephrine. The administration of this medication should not be delayed because the cascade of the shock can be alleviated by antagonizing histamine, which is in excess during anaphylactic shock. Epinephrine is preferred over diphenhydramine because epinephrine targets the histamine receptors in the airway. Question 25. The LPN is reinforcing education to a group of parents after an outbreak of pediculosis capitis at the local elementary school. Which of the following points should be included? Select all that apply. Choices: teach your children not to share hats or combs to prevent the spread of lice. It is important to apply the permethrin cream once as soon as you can. Parents will need to manually remove the lice and nits with a fine-tooth comb 2-3 times/day until there are no visible lice. Anyone can get lice, it is not indicative of a dirty house. Here are the options. Option A. Teach your children not to share hats or combs to prevent the spread of lice. Anyone can get lice, it is not indicative of a dirty house. Stress the importance of washing all bed linens and clothing that the child has recently used in hot water. The correct answer is option A. Teach your children not to share hats or combs to prevent the spread of lice. Anyone can get lice, it is not indicative of a dirty house. Stress the importance of washing all bed linens and clothing that the child has recently used in hot water. Correct answer. Teach your children not to share hats or combs to prevent the spread of lice. Anyone can get lice, it is not indicative of a dirty house. Stress the importance of washing all bed linens and clothing that the child has recently used in hot water. Question 26. The nurse is caring for a 16-year-old child who was brought to the emergency department by their mother after the child experienced a tonic-clonic seizure for which they are on seizure medications for. Which of the following drugs are used for long-term control of tonic-clonic seizures? Select all that apply. Choices: gabapentin, diazepam, methylphenidate, ethosuximide, carbamazepine. Here are the options. Option A. Gabapentin, carbamazepine. The correct answer is option A. Gabapentin, carbamazepine. Correct answer: gabapentin, carbamazepine. Gabapentin is an anti-epileptic drug commonly used for the treatment of seizures, including tonic-clonic seizures. It works by affecting calcium channels in the brain to reduce excitability, making it a suitable option for long-term seizure control. Carbamazepine is an anti-epileptic drug commonly used for the long-term control of various types of seizures, including tonic-clonic seizures. It works by reducing the excessive electrical activity in the brain and is a suitable option for long-term use. Question 27. A pregnant client at 37 weeks gestation arrives at the hospital with the following signs and symptoms: severe headache, blurred vision, and epigastric pain not relieved by pain medication. The nurse suspects the client is experiencing which condition? Here are the options. Option A. Preterm labor. Option B. Ectopic pregnancy. Option C. Severe preeclampsia. Option D. Preeclampsia. The correct answer is option C. Severe preeclampsia. Correct answer: severe preeclampsia. Severe preeclampsia is diagnosed if one or more of the following criteria are present. Severe preeclampsia is characterized by high blood pressure, proteinuria, presence of protein in urine, and organ dysfunction. It is a serious condition that requires immediate medical intervention to prevent complications for both the mother and the baby. Question 28. The licensed/practical vocational nurse LPN/VN has attended a staff education program about osteomyelitis. Which of the following statements by the nurse would indicate effective understanding? Here are the options. Option A. Roman IV antibiotic therapy is typically given for 7 to 14 days. Option B. The most common cause of acute osteomyelitis is a virus. Option C. A fever is present with temperatures typically greater than 101 degrees F 38.3 degrees C. Option D. Petechiae on the affected extremity is a common finding. The correct answer is option C. A fever is present with temperatures typically greater than 101 degrees F 38.3 degrees C. Correct answer. A fever is present with temperatures typically greater than 101 degrees F 38.3 degrees C. Acute osteomyelitis is manifested by localized bone pain, a fever, and swelling to the affected extremity. Question 29. The LPN is attending to a client who presents to the emergency department after suffering a burn injury. He describes the burn as extremely painful. Select the zone corresponding to the area up to which the wound could be extending. Here are the options. Option A. Eye. Option B. Roman II. Option C. Roman III. Option D. Roman IV. The correct answer is option B. Roman II. Correct answer, Roman II. Roman II represents the dermal layer, which is involved in a second-degree burn. Second-degree burns are the most painful of all the injuries. A wound extending through both the epidermis and dermis is classified as a. It is different from first-degree burns because blisters do form. In addition, the skin is moist and red. These burns extend through the upper dermis and into the lower layer of the dermis where most pain sensory receptors are located. This makes second-degree burns the most painful burns. Question 30. A 25-year-old is found unconscious with fever and a noticeable rash. Which of the following tests will most likely be a priority order? Choices: blood sugar check, blood cultures, arterial blood gases, CT scan. Here are the options. Option A. Blood cultures. The correct answer is option A. Blood cultures. Correct answer, blood cultures. Blood cultures would be ordered to investigate the source of fever and rash. Question 31. The licensed practical/vocational nurse LPN/VN is reinforcing teaching for a client newly diagnosed with multiple sclerosis. Which of the following statements by the client would indicate a correct understanding of the teaching? Here are the options. Option A. If I experience double vision, I should put an eye patch on both eyes for a few hours. Option B. Planning my activities should help manage the fatigue. Option C. I should plan to take a hot bath if my muscles spasm. Option D. This disease may cause me to have an increased sensitivity to pain. The correct answer is option B. Planning my activities should help manage the fatigue. Correct answer. Planning my activities should help manage the fatigue. Fatigue is a significant clinical feature associated with MS. Strategies to mitigate fatigue and maximize functioning include spacing activities out, planning them in a planner or whiteboard, and taking frequent breaks. Fatigue is often worsened during elevations in temperature. Thus, activities may be best performed early morning or late evening when temperatures are not as high. Question 32. The nurse is caring for a client prescribed dutasteride. The nurse understands this medication had achieved its therapeutic effect when the client reports decreased symptoms of. Here are the options. Option A, pyrosis. Option B, hypothyroidism. Option C, urinary retention. Option D, anxiety. The correct answer is option C, urinary retention. Correct answer, urinary retention. Dutasteride works by inhibiting this enzyme 5-alpha reductase, which normally converts testosterone to 5-alpha dihydrotestosterone DHT. DHT is a more potent form of testosterone and is the principal androgen responsible for stimulating prostatic growth. The growth of the prostate may cause BPH, therefore causing overflow incontinence, which is manifested as urinary retention. Decreased size of the prostate and less urinary retention is a therapeutic findings of this medication. Question 33. The nurse is reinforcing teaching regarding prescribed risperidone. Which statement, if made by the client, requires follow-up? Here are the options. Option A. I should report any abnormal movements that I develop. Option B. I will need to have weekly tests to monitor my white blood cells. Option C. If I get muscle stiffness, I should notify my physician. Option D. I will need to chew sugarless gum if I develop a dry mouth. The correct answer is option B. I will need to have weekly tests to monitor my white blood cells. Correct answer. I will need to have weekly tests to monitor my white blood cells. Risperidone is a second-generation antipsychotic used in delirium, schizophrenia, and some childhood disorders. Weekly white blood cell tests are not required with risperidone, as this is appropriate teaching for an individual receiving clozapine. Clozapine may cause neutropenia. Question 34. While assessing a laboring mother during a contraction, the LPN notes a decrease in fetal heart rate from 150 to 120 ppm. The heart rate slows for about 10 seconds and increases back to 150 bpm as the contraction ends. Which of the following correctly classifies this observation? Here are the options. Option A. Late deceleration. Option B. Moderate variability. Option C. Early deceleration. Option D. Marked variability. The correct answer is option C, early deceleration. Correct answer, early deceleration. Early decelerations occur when the fetal heart rate decreases at the same time as a contraction. In this question, the nurse noted a decrease from 150 to 120 bpm with the diminution, and then a return to baseline. This occurs due to the pressure of the head of the fetus on the pelvis or soft tissue, and no intervention is required by the nurse after an early deceleration. Question 35. The LPN is reinforcing discharge instructions to a client regarding his newly initiated digoxin. Which of the following statements by the client indicates that he correctly understood the instructions? Select all that apply. Choices. If I note color vision changes, I will call my eye doctor right away. I will check my pulse before each dose, and if the pulse is less than 60 bpm, I will hold digoxin and call my doctor. I will increase my calcium intake significantly. I will make sure I get enough potassium in my daily diet. Negative drama trope. Here are the options. Option A. I will check my pulse before each dose, and if the pulse is less than 60 bpm, I will hold digoxin and call my doctor. I will make sure I get enough potassium in my daily diet. The water pills that I am on may increase the risk of side effects with digoxin. The correct answer is option A. I will check my pulse before each dose, and if the pulse is less than 60 bpm, I will hold digoxin and call my doctor. I will make sure I get enough potassium in my daily diet. The water pills that I am on may increase the risk of side effects with digoxin. Correct answer. I will check my pulse before each dose, and if the pulse is less than 60 bpm, I will hold digoxin and call my doctor. I will make sure I get enough potassium in my daily diet. The water pills that I am on may increase the risk of side effects with digoxin. Dromotropic bradycardia, heart block, ventricular arrhythmias. Question 36. The practical nurse is caring for a client who has a chloride level of 1 mXL 98-16 mXL. Which of the following orders would the nurse expect for this patient? Select all that apply. Choices: bicarbonate Roman 4 normal saline Roman 4 lactated ringers furosemide carbonic anhydrase inhibitors. Here are the options. Option A. Bicarbonate Roman 4 lactated ringers. The correct answer is option A. Bicarbonate Roman 4 lactated ringers. Correct answer. Bicarbonate Roman 4 lactated ringers. Bicarbonate is a medication commonly used to decrease the chloride level. This client has hyperchloremia, as their chloride level is 1 mXL, which is above the normal range of 96-18 mXL. It is therefore appropriate to administer bicarbonate to lower the chloride level in this client. Question 37. The infection control nurse is collecting data on clients at risk for urinary tract infection UTI. Which client is at the greatest risk of developing a UTI? A client with. Here are the options. Option A. Chronic indwelling urinary catheter receiving intravenous diuretics. Option B. Diabetes mellitus who is receiving intravenous antibiotics for a wound infection. Option C. Obesity being treated for urge incontinence. Option D. A history of frequent bladder infections. The correct answer is option A. A chronic indwelling urinary catheter receiving intravenous diuretics. Correct answer. A chronic indwelling urinary catheter receiving intravenous diuretics. The most significant risk factor for urinary tract infection is the presence of an indwelling urinary catheter. Bacteria may colonize the tip of the catheter within 48 hours of its placement. Thus, the nurse recognizes that having this invasive device is a key risk factor for UTI. Question 38. Which of the following are important points about fever in children that the LPN should review with a family who is being discharged home today? Select all that apply. Choices: when to seek medical attention for a fever above a certain temperature, appropriate methods for managing a child's fever at home, signs and symptoms that may indicate a serious underlying condition, importance of monitoring the child's hydration status. Here are the options. Option A. When to seek medical attention for a fever above a certain temperature. Appropriate methods for managing a child's fever at home. Signs and symptoms that may indicate a serious underlying condition. The correct answer is option A. When to seek medical attention for a fever above a certain temperature. Appropriate methods for managing a child's fever at home. Signs and symptoms that may indicate a serious underlying condition. Correct answer. When to seek medical attention for a fever above a certain temperature. Appropriate methods for managing a child's fever at home. Signs and symptoms that may indicate a serious underlying condition. Importance of monitoring the child's hydration status. The LPN must emphasize the significance of monitoring the child's hydration when they have a fever. They should educate the family about signs of dehydration, such as decreased urine output, dry mouth, and lethargy, and encourage them to maintain adequate fluid intake. Question 39. The LPN is reinforcing teaching regarding nutrition for toddlers. Which of the following information should they include? Select all that apply. Choices. Whole milk can be offered to provide calcium and vitamin D. Using food as a reward can be a positive incentive. Good iron-rich food choices include melon and strawberries. Roasted vegetables are preferred over fried vegetables. Vitamin-rich foods should be given with iron to increase its absorption. Here are the options. Option A. Whole milk can be offered to provide calcium and vitamin D. Roasted vegetables are preferred over fried vegetables. The correct answer is option A. Whole milk can be offered to provide calcium and vitamin D. Roasted vegetables are preferred over fried vegetables. Correct answer. Whole milk can be offered to provide calcium and vitamin D. Roasted vegetables are preferred over fried vegetables. Plain cow milk, whole milk, or fortified unsweetened soy beverage can be offered at 12 months of age to help meet calcium, potassium, vitamin D, and protein needs. Flavored milk should be avoided until 24 months because they contain excessive sugars. Vegetables are an excellent source of fiber and are dense in vitamins. The healthy benefits of vegetables can be negated if they are fried. Roasting the vegetables are preferred. Question 40. The nurse is caring for a 2-year-old client. Among Erickson's stages of development, which of the following development stages would the nurse expect the client to be in? Here are the options. Option A. Autonomy versus shame and doubt. Option B. Industry versus inferiority. Option C. Trust versus mistrust. Option D. Initiative versus guilt. The correct answer is option A. Autonomy versus shame and doubt. Correct answer. Autonomy versus shame and doubt. Autonomy versus shame and doubt is the typical development stage for early childhood, which lasts from ages 2 to 3 years, so this is what the nurse would expect for her 2-year-old client. In autonomy versus shame and doubt, children seek to develop a sense of personal control over physical skills and independence knowledge. When they are successful, for example, with a task like toilet training, they feel independent, leading to a sense of autonomy. When they are not successful, they think they're a failure, resulting in shame and self-doubt. Question 41. The nurse is caring for a client diagnosed with pernicious anemia. The nurse should anticipate a prescription for which medication? Here are the options. Option A. Thiamine. Option B. Cyanocobalamin. Option C. Iron dextrin. Option D. Folic acid. The correct answer is option B. Cyanocobalamin. Correct answer, cyanocobalamin. Pernicious anemia is characterized by the inability of the body to utilize vitamin B12. This results in a decrease in hemoglobin, giving the patient anemia. The nurse should anticipate a prescription for cyanocobalamin, which may be administered parenterally for the greatest benefit. Question 42. NGN the emergency department nurse is caring for a 22-year-old with altered mental status. Item 1 of 1 choices. blood pressure 155/96 mm, Hg temperature 98.00 F37 OC 2330 22-year-old male client arrived at the emergency department ED with friends who were at a party and was observed snorting a white powder and started acting erratically. Here are the options. Option A, cocaine. Restrain the client. Physical violence. The correct answer is option A. Cocaine. Restrain the client. Physical violence. Correct answer. Cocaine. Restrain the client. Physical violence. 2,330 22-year-old male client arrived at the emergency department ED with friends who were at a party and was observed snorting a white powder and started acting erratically. Question 43. Which of the following statements should the nurse use to best describe a very low-calorie diet? Here are the options. Option A. This is a long-term treatment measure that assists obese people who can't lose weight. Option B. A VLCD contains very little protein. Option C. This diet can be used only when there is close medical supervision. Option D. This diet consists of solid food that is pureed to facilitate digestion and absorption. The correct answer is option C. This diet can be used only when there is close medical supervision. Correct answer. This diet can be used only when there is close medical supervision. Very low-calorie diets (VLCD) are used in the clinical treatment of obesity under close medical supervision. The diet is low in calories, high in quality proteins, and has a minimum of carbohydrates to spare protein and prevent ketosis. Very low-calorie diets, generally providing fewer than 8 kcal per day, became widely available for use in treating adult obesity in the 1980s. These diets, sometimes called protein-sparing modified fasts, were associated with significant medical risks, electrolyte abnormalities, arrhythmias, and sudden death. Question 44. The nurse cares for a newly admitted client with a full thickness burn of over 25% of their total body surface area. The nurse should take the following actions. Select all that apply. Choices: keep the client nothing by mouth, NPO status, prepare to infuse hypertonic saline, obtain an arterial blood gas, ABG, obtain a 12-lead electrocardiogram, irrigate the burns with chlorhexidine. Here are the options. Option A. Keep the client nothing by mouth, NPO status. Obtain a 12-lead electrocardiogram. Obtain an arterial blood gas, ABG. The correct answer is option A. Keep the client nothing by mouth, NPO status. Obtain a 12-lead electrocardiogram. Obtain an arterial blood gas, ABG. Correct answer. Keep the client nothing by mouth, NPO status. Obtain a 12-lead electrocardiogram. Obtain an arterial blood gas, ABG. Irrigate the burns with chlorhexidine. Question 45. Select all that apply. Choices: which of the following would the nurse consider to be a warning sign of the presence of physical abuse? Upper respiratory infections, bruises and broken bones, unintended pregnancies, repetitive strain injuries, alcoholism. Here are the options. Option A. Bruises and broken bones, unintended pregnancies, alcoholism. The correct answer is option A. Bruises and broken bones, unintended pregnancies, alcoholism. Correct answer. Bruises and broken bones, unintended pregnancies, alcoholism. Alcoholism. Question 46. The nurse is collecting data on a client with celiac disease. Which of the following findings would be expected? Select all that apply. Choices: dehydration, nausea and vomiting, abdominal distension, skin rash, constipation. Here are the options. Option A: dehydration, nausea and vomiting, abdominal distension. The correct answer is option A: dehydration, nausea and vomiting, abdominal distension. Correct answer: dehydration, nausea and vomiting, abdominal distension. A skin rash called dermatitis herpetiformis is a common celiac disease symptom characterized by itchy, blistering patches on the skin. Question 47. The nurse is caring for a client prescribed enoxaparin. Which laboratory value should the nurse monitor? Here are the options. Option A: platelet count. Option B: activated partial thromboplastin time, a PTT. Option C: international normalized ratio, INR. Option D: troponin. The correct answer is option A: platelet count. Correct answer: platelet count. Enoxaparin is a low molecular weight-based heparin, and the platelet count will need to be monitored if the client should develop heparin-induced thrombocytopenia, HIT. This condition is serious and results in a 50% decrease in the platelet count. Question 48. What are the benefits of providing oral care to a client in critical care? Select all that apply. Choices: it promotes the client's sense of well-being. It prevents deterioration of the oral cavity. It contributes to a decreased incidence of aspiration pneumonia. It eliminates the need for flossing. Here are the options. Option A: it promotes the client's sense of well-being. It prevents deterioration of the oral cavity. It contributes to a decreased incidence of aspiration pneumonia. The correct answer is option A. It promotes the client's sense of well-being. It prevents deterioration of the oral cavity. It contributes to a decreased incidence of aspiration pneumonia. Correct answer: it promotes the client's sense of well-being. It prevents deterioration of the oral cavity. It contributes to a decreased incidence of aspiration pneumonia. Question 49. As a practical nurse, what educational points should you reinforce with the parents of a toddler diagnosed with an imperforate anus? Select all that apply. Choices: toilet training will take longer for your child. Normal bowel habits can be established for your toddler over time. Do your best to have your child toilet trained before kindergarten starts. Bowel irrigations may help your toddler achieve normal bowel function. Here are the options. Option A: toilet training will take longer for your child. Normal bowel habits can be established for your toddler over time. Bowel irrigations may help your toddler achieve normal bowel function. The correct answer is option A. Toilet training will take longer for your child. Normal bowel habits can be established for your toddler over time. Bowel irrigations may help your toddler achieve normal bowel function. Correct answer: toilet training will take longer for your child. Normal bowel habits can be established for your toddler over time. Bowel irrigations may help your toddler achieve normal bowel function. Question 50. The nurse has reinforced medication instruction to a client who has been prescribed enalapril. Which of the following statements, if made by the client, would indicate a correct understanding of the teaching? Here are the options. Option A: I will notify my prescriber if I develop swelling of the face. Option B: I will need to weigh myself every day while taking this medication. Option C: I should eat foods high in potassium while I'm taking this medication. Option D: I will need lab work done every so often to evaluate my liver function. The correct answer is option A. I will notify my prescriber if I develop swelling of the face. Correct answer. I will notify my prescriber if I develop swelling of the face. Is a life-threatening adverse effect that is seen with ACE inhibitors such as enalapril. Angioedema may cause swelling anywhere in the body, but swelling in the face, lips, and eyes can be life-threatening. Question 51. The nurse is assisting a registered nurse in the care of a client with Bell's palsy. Which nursing diagnosis would be the highest priority for this client? Here are the options. Option A. Risk for infection. Option B. Risk for disturbed sensory perception. Option C. Risk for disturbed body image. Option D. Risk for ineffective tissue perfusion. The correct answer is option B. Risk for disturbed sensory perception. Correct answer. Risk for disturbed sensory perception. Bell's palsy causes acute facial paralysis or weakness in the muscles supplied by cranial nerve Roman 7, which can result in difficulty closing the eyelid, increased sound sensitivity, altered sense of taste, difficulty chewing/swallowing, and pain. Question 52. The nurse is assisting with the care of a client with a chest tube. Which of the following interventions would be appropriate? Select all that apply. Choices. Periodically check that all connections are secure. Tape the tubing to the bed. Check the tubing frequently for kinks and dependent loops. Refill the water seal chamber once a shift. Here are the options. Option A. Periodically check that all connections are secure. Check the tubing frequently for kinks and dependent loops. Assist with chest tube drainage by measuring and recording the amount of drainage, checking for proper suction, and ensuring that the drainage system is functioning properly. The correct answer is option A. Periodically check that all connections are secure. Check the tubing frequently for kinks and dependent loops. Assist with chest tube drainage by measuring and recording the amount of drainage, checking for proper suction, and ensuring that the drainage system is functioning properly. Correct answer. Periodically check that all connections are secure. Check the tubing frequently for kinks and dependent loops. Assist with chest tube drainage by measuring and recording the amount of drainage, checking for proper suction, and ensuring that the drainage system is functioning properly. Question 53. The primary healthcare provider PHCP prescribes lidocaine at 2 mg/min. The medication label reads lidocaine 1 gram in 500 ml of 0.9% saline. How many ml per hour will be administered to the client? Here are the options. Option A. 60 ml/hr. The correct answer is option A. 60 ml/hr. Correct answer. 60 ml/hr. 120 milligrams/1000 equals 0.12 grams. Question 54. The nurse reviews clinical data for a client 24 hours postpartum following a vaginal delivery. Which of the following findings would require follow-up by the nurse? Here are the options. Option A. White blood cell count 14,000 mm3. Option B. BUN 18 mg/dl. Option C. Capillary blood glucose 258 mg/dl. Option D. Urinary output 60 ml/hr. The correct answer is option C. Capillary blood glucose 258 mg/dl. Correct answer. Capillary blood glucose 258 mg/dl. This blood glucose is greater than 250 mg/dl and is clinical hyperglycemia. Regardless if the client has a history of diabetes mellitus, this CBG requires follow-up because it is the only abnormal clinical data. Question 55. The LPN is reinforcing education to a client about modifiable risk factors and risk factors that are not. Which of the following is most likely able to be corrected? Here are the options. Option A, genetic predisposition. Option B, lifestyle choices. Option C, depression. Option D, all of the above. The correct answer is option B, lifestyle choices. Correct answer, lifestyle choices. Lifestyle choices are the risk factors that are most likely able to be corrected. Poor lifestyle choices place a person at risk, and they are often considered risky behaviors. Question 56. The nurse is caring for a teenager who is recovering from a tonsillectomy. The nurse walks in the room and sees the client eating chips and salsa from a Mexican restaurant. Which of the following responses is most appropriate? Here are the options. Option A, I love that restaurant. Their chips are so good. Option B, you cannot eat anything yet, I am sorry. Option C, chips are not a good choice right now because you need a high-protein diet after your surgery. Option D, those chips are really hard on the back of your throat where you had your surgery. I'm worried they could cause you to bleed if they damage your incision site. Let's get something softer for you to eat right now. The correct answer is option D. Those chips are really hard on the back of your throat where you had your surgery. I'm worried they could cause you to bleed if they damage your incision site. Let's get something softer for you to eat right now. Correct answer. Those chips are really hard on the back of your throat where you had your surgery. I'm worried they could cause you to bleed if they damage your incision site. Let's get something softer for you to eat right now. This is the most appropriate response by the nurse. She correctly explains to the client that the sharp tortilla chips would be really hard on the client's surgical site after a tonsillectomy. Allowing clients to eat foods like chips or popcorn after surgery in the back of the throat would put them at risk for damage to the incision and subsequent hemorrhage. Offering the client something soft, such as gelatin or soup, is the most appropriate. Question 57. The nurse reviews prescriptions for assigned clients. Which prescription should the nurse clarify with the primary healthcare provider PHCP? Here are the options. Option A, albuterol via nebulizer for a patient with hypokalemia. Option B, clozapine for a patient with severe schizophrenia. Option C, lisinopril for a patient with congestive heart failure. Option D, verapamil for a patient with migraine headaches. The correct answer is option A, albuterol via nebulizer for a patient with hypokalemia. Correct answer, albuterol via nebulizer for a patient with hypokalemia. Albuterol is a bronchodilator that is used for asthma exacerbations. Adversely, this medication may lower serum potassium levels. The nurse should question this order as this medication may decrease the potassium further. Question 58. NGN*, the nurse is caring for a client in the mental health unit experiencing psychosis. Item 1 of 1 choices. Hyperlipidemia. Medical history. Olanzapine 10 mg/PO daily. Reassign the client to a private room. Here are the options. Option A, ask if the client hears any voices. Reassign the client to a private room. The correct answer is option A, Ask if the client hears any voices. Reassign the client to a private room. Correct answer. Ask if the client hears any voices. Reassign the client to a private room. This client is experiencing overt paranoia, and the nurse should ask if the client hears any voices. Auditory hallucinations are the most common perceptual disturbance associated with schizophrenia and may contribute to a client's paranoia. If auditory hallucinations are evident, this allows the nurse to intervene by exploring the content of the hallucination and reorientating the client. Question 59. The nurse is caring for a client with a suspected femoral artery occlusion. The nurse should take which action? Here are the options. Option A. Elevate the affected leg. Option B. Apply a cold compress. Option C. Notify the primary health care provider PHCP. Option D. Perform passive range of motion to the affected leg. The correct answer is option C. Notify the primary healthcare provider PHCP. Correct answer. Notify the primary healthcare provider PHCP. The essential action for a client with a suspected femoral artery occlusion is to notify the PHCP or rapid response. This is a medical emergency. If untreated, this extremity may have to be amputated because of the interruption in distal perfusion. Question 60. Which of these is the best example of an ethical principle in nursing? Here are the options. Option A. Fidelity. The nurse maintained honesty with the client during any education and care. Option B. Veracity. The nurse followed through with any promises made to the client during his or her care. Option C. Beneficence. The nurse promoted the client to be respected and involved in his or her care. Option D. Non-maleficence. The nurse did not cause harm to the client. The correct answer is option D. Non-maleficence. The nurse did not cause harm to the client. Correct answer. Non-maleficence. The nurse did not cause harm to the client. The nurse did not cause harm to the client, which is known as non-maleficence. The ethical principles that nurses must adhere to are the principles of justice, beneficence, non-maleficence, accountability, fidelity, autonomy, and veracity. Question 61. The nurse is caring for a child diagnosed with a coarctation of the aorta who is scheduled for a repair tomorrow morning. When she auscultates his lung sounds, she notes crackles and rails. The nurse knows this is a sign of which of the following? Here are the options. Option A. Pulmonary congestion. Option B. Foreign body aspiration. Option C. Pneumonia. Option D. Systemic congestion. The correct answer is option A. Pulmonary congestion. Correct answer. Pulmonary congestion. Crackles and rails are indicative of pulmonary congestion. Since this child has coarctation of the aorta, there is too much blood backing up in the lungs. It is impossible for the left side of the heart to move sufficient blood forward, working against the coarctation. This causes the backup of blood in the lungs, and therefore the crackles and rails indicative of pulmonary congestion. Question 62. The nurse receives the following critical laboratory result for a client with end-stage renal disease. The nurse anticipates the physician to prescribe which blood product? See the image. Here are the options. Option A. Packed red blood cells PRBCS. Option B. Fresh frozen plasma FFP. Option C. Albumin. Option D. Platelets. The correct answer is option A. Packed red blood cells PRBCS. Correct answer. Packed red blood cells PRBCS. This hemoglobin and hematocrit are critically low. A transfusion of PRBC is typically indicated once the hemoglobin is 7D/DL or less. Question 63. The primary healthcare provider PHCP prescribes a bolus of regular insulin prior to a continuous infusion. The prescription is for 0.1 units/kg. The client weighs 256 pounds. How many units of insulin should the nurse administer to the client? Choices: 256 pounds, right arrow, 116.36 kg, 0.1 units x 116.36 kg equals 11.63 units. Next, multiply the prescribed dosage by the client's weight. Here are the options. Option A, 12 units. The correct answer is option A, 12 units. Correct answer, 12 units. Next, multiply the prescribed dosage by the client's weight. Question 64. The nurse is helping a client with a chest tube ambulate to the bathroom. The client turns suddenly and the chest tube becomes dislodged. Which of the following is the priority nursing action? Here are the options. Option A, immediately reinsert the tube and call for help. Option B, place your hand over the chest tube site and yell for help. Option C, place a sterile dressing taped on 3 sides over the chest tube site and call for help. Option D, monitor the client's vital signs while he finishes ambulating to the bathroom and then call for help. The correct answer is option C. Place a sterile dressing taped on 3 sides over the chest tube site and call for help. Correct answer. Place a sterile dressing taped on 3 sides over the chest tube site and call for help. Placing a sterile dressing taped on 3 sides over the chest tube site and calling for help is the appropriate action. By placing a sterile dressing over the site, the nurse follows infection prevention. By taping the dressing on 3 sides, the dressing will cover the site and prevent detention pneumothorax by allowing exhaled air to escape the dressing. The nurse should then immediately call for help. Question 65. The LPN is caring for the following clients. The nurse should identify which client is at the highest risk for falling. Here are the options. Option A, 88-year-old admitted with a chest tube secondary to pneumothorax and has a history of dementia. Option B, 44-year-old admitted with heart failure, has a peripheral Roman 4, and receiving Roman 4 furosemide. Option C, 33-year-old admitted with cholecystitis, has a peripheral Roman 4, and is receiving Roman 4 hydromorphone. Option D, 28-year-old admitted with bacteremia, is receiving intravenous fluids via central line, and is diaphoretic. The correct answer is option A. 88-year-old admitted with a chest tube secondary to pneumothorax and has a history of dementia. Correct answer. 88-year-old admitted with a chest tube secondary to pneumothorax and has a history of dementia. This client has advanced age, has a medical device that impedes their mobility, and has cognitive impairments. Thus, all these risk factors put this client at a very high risk of falling. Question 66. Which nursing action is performed correctly when providing care for a newly placed gastrostomy tube of a postoperative client? Here are the options. Option A, the nurse dips a cotton-tipped applicator into the sterile saline solution and gently cleans around the insertion site. Option B, the nurse wets a washcloth and washes the area around the tube with soap and water. Option C, the nurse adjusts the external disc every 3 hours to avoid crusting around the tube. Option D, the nurse tapes a gauze dressing over the site after cleansing it. The correct answer is option A. The nurse dips a cotton-tipped applicator into the sterile saline solution and gently cleans around the insertion site. Correct answer. The nurse dips a cotton-tipped applicator into the sterile saline solution and gently cleans around the insertion site. When caring for a new gastrostomy tube, the nurse would use a cotton-tipped applicator dipped in sterile saline to gently cleanse the area, removing any crust or drainage. Question 67. Your client is receiving a non-steroidal anti-inflammatory drug NSAID in addition to a narcotic analgesic. The client wonders why an NSAID is necessary since the narcotic analgesic offers better pain relief. How would you respond to the client's question? Here are the options. Option A. I don't know, and I suggest that you ask your doctor when you see her the next time. Option B. You are getting the NSAID because we are trying to wean you off the narcotic analgesic for moderate to severe pain. Option C. You are getting the NSAID, so the effects of the narcotic analgesic to combat your pain are more effective. Option D. You are getting the NSAID because it is a placebo and it is proven to be effective for severe pain. The correct answer is option C. You are getting the NSAID, so the effects of the narcotic analgesic to combat your pain are more effective. Correct answer. You are getting the NSAID, so the effects of the narcotic analgesic to combat your pain are more effective. You are getting the NSAID, so the effects of the narcotic analgesic to combat your pain are more effective is an appropriate response to the client's query. An NSAID is a medication used in combination with narcotic analgesics to treat moderate to severe pain or used to enhance pain relief provided by other analgesics. The primary function of NSAID is to reduce inflammation. Therefore, NSAID are helpful in treating the Question 68. The nurse is caring for a client diagnosed with epilepsy. The nurse should anticipate a prescription for which of the following medications? Select all that apply. Choices: topiramate, risperidone, prazosin, hydroxyzine, lorazepam. Here are the options. Option A. Topiramate, lorazepam. The correct answer is option A. Topiramate, lorazepam. Correct answer: topiramate, lorazepam. Epilepsy is an idiopathic condition that requires maintenance treatment by using anticonvulsants. Topiramate is an anticonvulsant that may be used in the prevention of seizures. Lorazepam is also indicated for epilepsy in the event of a client experiencing an acute tonic-clonic or complex partial seizure. Topiramate should be used for maintenance purposes, and lorazepam would be indicated for an acute seizure. Question 69. He primary healthcare provider PHCP prescribes 150 ml of sterile water to be administered over 1 hour. The drop factor is 15 GTTS/ml. The nurse sets the flow rate at how many drops per minute? Here are the options. Option A. 38 GTTS/minute. The correct answer is option A. 38 GTTS/minute. Correct answer: 38 GTTS/minute. 150 ml x 15 GTT equals 2,250 ml. Question 70. The nurse receives a prescription for donepezil. The nurse understands that this medication is used to treat. Here are the options. Option A. Guillain-Barré syndrome. Option B. Parkinson's disease. Option C. Alzheimer's disease. Option D. Meniere's disease. The correct answer is option C. Alzheimer's disease. Correct answer: Alzheimer's disease. Alzheimer's disease is the most common form of dementia. Treatment options are limited but may include donepezil, which is approved to treat mild, moderate, or severe Alzheimer's disease. This medication is an acetylcholinesterase inhibitor. Question 71. *NGN*. The emergency department nurse is caring for a 27-year-old male client. Item 1 of 1 choices. Cluster headache, trigeminal neuralgia. Here are the options. Option A, cluster headache. The correct answer is option A, cluster headache. Correct answer, cluster headache. This client is experiencing a cluster headache. Cluster headaches have an abrupt onset, are more common in men, and are episodic. Question 72. The nurse is assisting a client using a fracture bedpan. Which action should the nurse take? Here are the options. Option A. Position the client prone while applying the bedpan. Option B. Raise the head of bed to 30 degrees. Option C. Place the open rim of the bedpan facing toward the head of the bed. Option D. Lower all of the side rails. The correct answer is option B. Raise the head of bed to 30 degrees. Correct answer. Raise the head of bed to 30 degrees. Placing the head of bed at 30 to 60 degrees will facilitate comfort by preventing strain on the lumbar spinal column. Question 73. Which of the following conditions may cause an increased cortisol level in a client? Here are the options. Option A. Addison's disease. Option B. Congestive heart failure. Option C. Renal failure. Option D. Cushing's disease. The correct answer is option D. Cushing's disease. Correct answer. Cushing's disease. Cushing syndrome produces elevated cortisol levels. Cortisol is best known for helping support the body's natural fight-or-flight instinct in a crisis. It also plays a vital role in several other body functions, including managing the use of carbohydrates, fats, and proteins, regulating blood pressure, increasing blood sugar levels, controlling the sleep/wake cycle, and boosting energy to help manage stress and restore balance. Question 74. Place the following instructions for the use of a metered dose inhaler MDI without a spacer in the correct order. Choices. Open your mouth and place the mouthpiece 1 to 2 inches away from the mouth. Press down firmly on the canister and breathe deeply through the mouth. Tilt your head back and breathe out fully. Wait at least 1 minute between puffs. Hold your breath for at least 10 seconds. Here are the options. Option A. Remove the inhaler cap and shake the inhaler. Open your mouth and place the mouthpiece 1 to 2 inches away from the mouth. Tilt your head back and breathe out fully. The correct answer is option A. Remove the inhaler cap and shake the inhaler. Open your mouth and place the mouthpiece 1 to 2 inches away from the mouth. Tilt your head back and breathe out fully. Correct answer. Remove the inhaler cap and shake the inhaler. Open your mouth and place the mouthpiece 1 to 2 inches away from the mouth. Tilt your head back and breathe out fully. Question 75. Which of the following statements correctly outlines the proper flow of blood through the heart? Here are the options. Option A. Superior and inferior vena cavas, right arrow, right atrium, right arrow, tricuspid valve, right arrow, right ventricle, right arrow, pulmonary valve, right arrow, pulmonary artery, right arrow, lungs, right arrow, pulmonary veins, right arrow, left atrium, right arrow, mitral valve, right arrow, left ventricle, right arrow, aortic valve, right arrow, aorta, right arrow, systemic circulation. Option B. Superior and inferior vena cavas, right arrow, right atrium, right arrow mitral valve, right arrow, right ventricle, right arrow pulmonary valve, right arrow pulmonary artery, right arrow lungs, right arrow pulmonary veins, right arrow left atrium, right arrow tricuspid valve, right arrow left ventricle, right arrow aortic valve, right arrow aorta, right arrow systemic circulation. Option C. Superior and inferior vena cavas, right arrow, right atrium, right arrow tricuspid valve, right arrow, right ventricle, right arrow pulmonary valve, right arrow pulmonary veins, right arrow lungs, right arrow pulmonary artery, right arrow left atrium, right arrow mitral valve, right arrow left ventricle, right arrow aortic valve, right arrow aorta, right arrow systemic circulation. Option D. Superior and inferior vena cavas, right arrow, right atrium, right arrow tricuspid valve, right arrow, right ventricle, right arrow aortic valve, right arrow pulmonary veins, right arrow lungs, right arrow pulmonary artery, right arrow left atrium, right arrow mitral valve, right arrow left ventricle, right arrow pulmonary valve, right arrow aorta, right arrow systemic circulation. The correct answer is option A. Superior and inferior vena cavas, right arrow, right atrium, right arrow tricuspid valve, right arrow, right ventricle, right arrow pulmonary valve, right arrow pulmonary artery, right arrow lungs, right arrow pulmonary veins, right arrow left atrium, right arrow mitral valve, right arrow left ventricle, right arrow aortic valve, right arrow aorta, right arrow systemic circulation. Correct answer. Superior and inferior vena cavas, right arrow, right atrium, right arrow tricuspid valve, right arrow, right ventricle, right arrow pulmonary valve, right arrow pulmonary artery, right arrow lungs, right arrow pulmonary veins, right arrow left atrium, right arrow mitral valve, right arrow left ventricle, right arrow aortic valve, right arrow aorta, right arrow systemic circulation. This is the proper flow of blood through a healthy heart with normal anatomy. The superior and inferior vena cavae are the large veins that bring back deoxygenated blood from the body to the heart's right atrium. The blood enters the right atrium, passes through the tricuspid valve into the right ventricle, and is then pumped into the lungs through the pulmonary artery. In pulmonary circulation, the deoxygenated blood drops off its carbon dioxide plus waste products and picks up fresh oxygen to deliver to the body. Blood is now oxygenated. The blood returns to the left atrium through the pulmonary veins that pass through the mitral valve to enter the left ventricle, which is then pumped out to the body through the aorta. Oxygenated blood is now in the systemic circulation, where it can deliver oxygen to all the tissues of the body. Question 76. 25-year-old female reports intermittent abdominal pain, bloating, and flatulence that has lasted for several months. Which of the following would the nurse tell the client to avoid? Here are the options. Option A. Fiber. Option B. Broccoli. Option C. Yogurt. Option D. Simple carbohydrates. The correct answer is option B. Broccoli. Correct answer, broccoli. Broccoli forms gas in the stomach and should be avoided for this client. Question 77. You are working in the intensive care nursery and are assigned to take care of an infant withdrawing from cocaine. At your first assessment, you appreciate the following: a high-pitched cry, no tremors, increased muscle tone, sleeping for 3 hours in between feedings, no congestion, RR equals 42, excessive sucking on the pacifier, poor feeding, no vomiting, and no loose stools. What is the NAS score for this client? Here are the options. Option A, 7. Option B, 12. Option C, 2. Option D, 8. The correct answer is option A, 7. Correct answer, 7. High-pitched cry equals 2 points. Each of these observations gives you a NAS score for this infant. Question 78. The nurse is reinforcing education for a client with Graves' disease. Which of the following client statements indicates effective understanding? Here are the options. Option A. I will take my pulse daily and report a rate less than 60 beats/minute. Option B. I am going to add hot yoga to my exercise routine. Option C. I will increase the amount of fiber in my diet. Option D. I should tell my physician if my blood pressure's top number exceeds 140. The correct answer is option D. I should tell my physician if my blood pressure's top number exceeds 140. Correct answer. I should tell my physician if my blood pressure's top number exceeds 140. Graves' disease is the most common form of hyperthyroidism. A significant complication of this condition is the potential for a thyroid storm. A thyroid storm is caused by a surge in thyroid hormone in the bloodstream, which causes the client to experience tachycardia, fever, hypertension, diaphoresis, and tachydysrhythmias. Question 79. The nurse is caring for a client who experienced a myocardial infarction MI 24 hours ago. It would be necessary for the nurse to immediately notify the primary health care provider PHCP if the client has which of the following? Here are the options. Option A. An elevated troponin level. Option B. A white blood cell WBC count of 13,000 mm3. Option C. Apprehension about attending cardiac rehabilitation. Option D. Crackles auscultated to the midline of the lung fields. The correct answer is option D. Crackles auscultated to the midline of the lung fields. Correct answer. Crackles auscultated to the midline of the lung fields. Following MI, the client is at risk for developing pulmonary edema. This is caused by the heart's inability to eject blood, consequently caused by an insult to the myocardium. When caring for a client with an MI, the nurse should monitor the client for life-threatening ventricular arrhythmias as well as pulmonary edema. If a client is experiencing this complication, they will develop crackles in the lung fields, tachypnea, and hypoxia. Question 80. Which procedures necessitate the use of surgical asepsis techniques? Select all that apply. Choices: intramuscular medication administration, donning gloves in the operating room, Foley catheter insertion, central line intravenous medication administration. Here are the options. Option A. Central line intravenous medication administration, donning gloves in the operating room, Foley catheter insertion. The correct answer is option A. Central line intravenous medication administration, donning gloves in the operating room, Foley catheter insertion. Correct answer. Central line intravenous medication administration, donning gloves in the operating room, Foley catheter insertion. Central line intravenous medication administration. Question 81. When experiencing conflict with another nurse that is not resolvable between the parties, what is the most appropriate action for the nurse moving forward? Here are the options. Option A. Report the conflict to the Director of Nursing over the unit. Option B. Report the conflict to the Nurse Manager of the unit. Option C. Report the conflict to the assigned charge nurse of the unit. Option D. Discuss the conflict with another nurse to attempt resolution of the issue. The correct answer is option C. Report the conflict to the assigned charge nurse of the unit. Correct answer. Report the conflict to the assigned charge nurse of the unit. It is important to follow the appropriate chain of command in a professional setting and not overstep any levels when moving the issue up the ladder. Question 82. The nurse is assessing a patient who reports intermittent tingling and numbness in bilateral lower extremities. Which intervention by the nurse would be most important to prevent injury for this patient? Here are the options. Option A. Perform Semmes-Weinstein monofilament test. Option B. Refer the patient for a diabetic diet consult. Option C. Obtain an order for gabapentin. Option D. Reinforce teaching regarding appropriate footwear use. The correct answer is option D. Reinforce teaching regarding appropriate footwear use. Correct answer. Reinforce teaching regarding appropriate footwear use. Peripheral neuropathy puts the patient at increased risk for traumatic injury and tissue breakdown since the patient may not notice early skin damage due to altered sensation. Of the options provided, educating the patient on proper footwear is the only action that aims to prevent injury related to the patient's altered sensation in the feet. Question 83. The nurse is reinforcing teaching for individuals at a health fair about the human immunodeficiency virus HIV. It would be correct for the nurse to indicate which of the following risk factors indicate the need for HIV testing. Select all that apply. Choices: pregnancy, have a sexually transmitted infection, men who have sex with men, MSM, engaged in sex work, housed in a correctional institution such as jail and prison, the use of injection drugs. Here are the options. Option A. Pregnancy, engaged in sex work, have a sexually transmitted infection. The correct answer is option A. Pregnancy, engaged in sex work, have a sexually transmitted infection. Correct answer. Pregnancy, engaged in sex work, have a sexually transmitted infection. The use of injection drugs. Question 84. Which of the following are opportunistic infections that adversely affect patients infected with HIV/AIDS? Select all that apply. Choices: Kaposi's sarcoma, Wilms sarcoma, tuberculosis, toxoplasma gondii, visual loss. Here are the options. Option A. Kaposi's sarcoma, tuberculosis, toxoplasma gondii. The correct answer is option A. Kaposi's sarcoma, tuberculosis, toxoplasma gondii. Correct answer. Kaposi's sarcoma, tuberculosis, toxoplasma gondii. Visual loss. Question 85. The nurse is teaching a course regarding bone marrow toxicity. The nurse should reinforce that the most serious form of bone marrow toxicity is. Here are the options. Option A. Aplastic anemia. Option B. Leukocytosis. Option C. Thrombocytopenia. Option D. Granulocytosis. The correct answer is option A. Aplastic anemia. Correct answer. Aplastic anemia. Aplastic anemia is the result of a hypersensitivity reaction and is often irreversible. It leads to pancytopenia, a severe decrease in all cell types: red blood cells, white blood cells, and platelets. Question 86. Your 78-year-old client, who has been receiving antibiotics for 10 days, tells you that he has frequent watery stools. Which action will you take first? Here are the options. Option A. Place the client on contact precautions. Option B. Instruct the client about correct hand-washing techniques. Option C. Obtain stool specimens for culture. Option D. Notify the physician about the loose stools. The correct answer is option A. Place the client on contact precautions. Correct answer. Place the client on contact precautions. The client's age, history of antibiotic therapy, and watery stools suggest that he may have Clostridium difficile infection. The initial action is to place him on to prevent the spread of C. difficile to other clients. C. difficile is a spore-forming bacillus that infects the gastrointestinal GI tract following treatment of other infections with antibiotics. It is one of the few hospital-acquired infections high as increasing in frequency. C. difficile spores are transferred to clients mainly via the hands of healthcare personnel who have touched a contaminated surface or item. Question 87. The nurse is caring for a child in the emergency department ED who sustained a bite by a rabid animal. The nurse should take which initial action? Here are the options. Option A. Assess the wound's length and width. Option B. Cleanse the wound with soap and water. Option C. Obtain a prescription for an antibiotic. Option D. Report the bite to animal control. The correct answer is option B. Cleanse the wound with soap and water. Correct answer. Cleanse the wound with soap and water. Cleansing the wound inflicted by a rabid animal with soap and water is to prevent a rabies infection. Aggressive wound cleaning minimizes the exposure to this infection, which can be fatal without the appropriate cleaning and post-exposure prophylaxis. Question 88. The licensed practical/vocational nurse LPN/VN is assisting a registered nurse RN care for a client receiving mechanical ventilation for a traumatic brain injury. Which of the following actions by the RN requires the PN/VN to intervene? Here are the options. Option A. Suctioning the client when the high-pressure alarm sounds. Option B. Hyperventilating with 100% FiO2 prior to suctioning. Option C. Performs oral care with a chlorhexidine solution. Option D. Maintaining the head of the client's bed at 90 degrees. The correct answer is option D. Maintaining the head of the client's bed at 90 degrees. Correct answer. Maintaining the head of the client's bed at 90 degrees. Maintaining a client's head of the bed at 90 degrees is detrimental for a client with a traumatic brain injury. The client should avoid hip and neck flexion as this raises ICP. Head of the bed recommendations for a client with a risk for increased ICP is 30 to 45 degrees. This is also recommended to prevent the client from developing ventilator-acquired pneumonia, as the question states the client is on mechanical ventilation. Question 89. The nurse is participating in a committee with the objective of promoting healthcare justice in the community. Which of the following recommendations should the nurse make to achieve the goal? Here are the options. Option A. Establishing interdisciplinary collaboration between nursing and nutritional services. Option B. Providing more confidential waste containers at local drugstores. Option C. Offering free telehealth offerings in underserved areas of the community. Option D. Offering inpatient clients the ability to select their meal times. The correct answer is option C. Offering free telehealth offerings in underserved areas of the community. Correct answer. Offering free telehealth offerings in underserved areas of the community. The premise of social justice is expanding access to affordable healthcare for individuals. The nurse recommending health services for underserved areas is a way to improve health inequalities in the community. Another example would be the nurse endorsing expanding health services and eligibility for Medicaid. Question 90. The nurse is reinforcing education to a client with glaucoma. Which of the following classifications of medication should the nurse instruct the client to avoid? Here are the options. Option A, osmotic diuretics. Option B, beta-adrenergic blockers. Option C, anticholinergics. Option D, alpha-2 adrenergic blockers. The correct answer is option C, anticholinergics. Correct answer, anticholinergics. Anticholinergic medications can increase the IOP and worsen clients' condition with glaucoma. Anticholinergic agents also can produce antral side effects such as confusion, unsteady gait, or drowsiness in adults. Children may become restless or spastic. Glaucoma is one of the leading causes of blindness in the United States. In some cases, it is genetic. In others, it may occur due to eye injury or disease. Some medications may contribute to glaucoma development, such as long-term use of topical glucocorticoids, antihypertensives, antihistamines, and antidepressants. The primary risk factor associated with glaucoma includes high blood pressure. Question 91. The nurse is caring for a client receiving prescribed atomoxetine for attention deficit hyperactivity disorder ADHD. Which clinical data should the nurse monitor while the client receives this medication? Choices: liver function tests, urine analysis, fasting blood glucose, complete blood count. Here are the options. Option A, liver function tests. The correct answer is option A, liver function tests. Correct answer, liver function tests. Atomoxetine is a non-stimulant treatment option for ADHD. This medication may adversely cause hepatic injury, and the nurse should monitor the client's liver function tests as they receive this medication. Atomoxetine is an attractive option for ADHD as it may not cause the nervousness, weight loss, and tics associated with stimulants. Question 92. The nurse is caring for a client who is newly placed on a clozapine prescription. Which of the following teaching points should the nurse reinforce? Here are the options. Option A, maintain a healthy diet because of weight gain. Option B, exercise regularly and maintain hydration. Option C, expect excessive secretions in the mouth. Option D, obtain follow-up laboratory work. The correct answer is option D, obtain follow-up laboratory work. Correct answer, obtain follow-up laboratory work. Follow-up laboratory work is essential for a client taking clozapine. The medication may adversely cause neutropenia. The client will be instructed to obtain this necessary laboratory work to ensure they are not experiencing agranulocytosis, which may make the client susceptible to infection. Question 93. What signs should the LPN look for when assessing a 5-year-old girl with hemophilia with a recurring episode of hemarthrosis? Choices: swelling and warmth in the affected joint, pain and tenderness in the affected joint, fever and chills, limited range of motion in the affected joint, ecchymosis or bruising around the affected joint. Here are the options. Option A, swelling and warmth in the affected joint, limited range of motion in the affected joint, pain and tenderness in the affected joint. The correct answer is option A, swelling and warmth in the affected joint, limited range of motion in the affected joint, pain and tenderness in the affected joint. Correct answer, swelling and warmth in the affected joint, limited range of motion in the affected joint, pain and tenderness in the affected joint. Hemophilia can cause easy bruising, and ecchymosis around the joint suggests bleeding into the area. Question 94. The nurse is precepting a newly hired nurse to administer an intramuscular injection to an adult. Which action by the newly hired nurse requires follow-up? Here are the options. Option A. Prepares to administer the medication in the dorsogluteal. Option B. Prepares to insert the needle at a 90-degree angle. Option C. Uses isopropyl alcohol to clean the area prior to injection. Option D. Washes their hands before and after the procedure. The correct answer is option A. Prepares to administer the medication in the dorsogluteal. Correct answer. Prepares to administer the medication in the dorsogluteal. This action requires follow-up as the dorsogluteal site is not recommended. The dorsogluteal site is not recommended because of potential damage to nearby nerves and blood vessels. Question 95. The primary healthcare provider PHCP prescribes 100 ml of 0.9% saline to infuse over 45 minutes. How many ml per hour will be administered to the client? Here are the options. Option A. 133 ml/HR. The correct answer is option A. 133 ml/HR. Correct answer. 133 ml/HR. 45 minutes/60 minutes equals 0.75 HRS. Question 96. Which of the following clients fall within the scope of practice of a licensed practical/vocational nurse LPN/VN? Select all that apply. Choices: a client requiring an assessment of their current medications, a client needing a nasogastric tube NGT for enteral feedings, a client with an insulin pump who is unsure of how to load the insulin, a client requesting additional teaching on discharge prescriptions, a client requiring airborne isolation, and bronchodilators via an inhaler. Here are the options. Option A. A client needing a nasogastric tube NGT for enteral feedings. A client requiring airborne isolation and bronchodilators via an inhaler. The correct answer is option A. A client needing a nasogastric tube NGT for enteral feedings. A client requiring airborne isolation and bronchodilators via an inhaler. Correct answer. A client needing a nasogastric tube NGT for enteral feedings. A client requiring airborne isolation and bronchodilators via an inhaler. Practical/vocational nurses should get the most stable client assignment. Skills such as the insertion of an NGT are within the scope of an LPN/VN. Further, LPN/VNs may care for a client in isolation and administer bronchodilators via an inhaler. Question 97. Wilms tumor is a type of cancer most common in children under the age of 5. Where do these tumor cells originate from? Here are the options. Option A. Lung cells. Option B. Epithelial cells. Option C. Adipose cells. Option D. Renal cells. The correct answer is option D. Renal cells. Correct answer, renal cells. Wilms tumor, also known as nephroblastoma, is a cancer of the kidneys. Its tumor cells originate from renal cells. Question 98. The nurse is caring for a client who is in psychosis. The client states, "You all are trying to kill me." Which of the following responses would be most appropriate for the nurse to make? Here are the options. Option A. What you're experiencing is not real. Option B. Are you hearing voices? Option C. You're safe here, please be calm. Option D. What makes you think we are trying to kill you? The correct answer is option D. What makes you think we are trying to kill you? Correct answer. What makes you think we are trying to kill you? A client experiencing psychosis does not exhibit a rational thought process and may have impaired reality testing. If the client is paranoid, the nurse should attempt to understand the paranoia as the client has likely misconstrued an action. Question 99. The nurse is caring for a group of assigned clients. The nurse should follow up on the client who. Here are the options. Option A has a closed chest drainage system and has redness at the insertion site. Option B is receiving treatment for ulcerative colitis and has had 3 bloody stools in the past hour. Option C is being treated for a concussion and reports a headache rated as 4 on a scale of 0 no pain to 10 severe pain. Option D is being treated for an ischemic stroke and has a blood pressure of 158 mmHg. The correct answer is option D. Is being treated for an ischemic stroke and has a blood pressure of 158 mmHg. Correct answer is being treated for an ischemic stroke and has a blood pressure of 100/58 mmHg. The client with and will require intense blood pressure monitoring because a low blood pressure will decrease cerebral perfusion, which is necessary for the unaffected areas of the brain. An optimal blood pressure for an ischemic stroke is 150/100 mmHg to ensure cerebral perfusion. Allowing the blood pressure to be this high is considered permissive hypertension. Blood pressure lower than 150/100 mmHg may cause further injury because of decreased cerebral perfusion. Likewise, the blood pressure should not exceed 185/110 mmHg in an ischemic stroke because this may cause an extension of the stroke. Question 100. Which of these would be most important to include in discharge teaching for a client with a platelet count of 40.3 L40 x 10(9/L)? Here are the options. Option A. Be sure to take your aspirin with meals daily. Option B. You may continue to shave with a straight edge razor. Option C. Use a soft toothbrush and floss gently. Option D. You should take a multivitamin daily. The correct answer is option C. Use a soft toothbrush and floss gently. Correct answer. Use a soft toothbrush and floss gently. Diminished production, caused by viral infections, vitamin deficiencies, aplastic anemia, or drug-induced. This client has thrombocytopenia and should be on bleeding precautions. Using a soft toothbrush and flossing gently can prevent the gum tissue from bleeding. Platelets. Thrombocytes are important for blood clotting. The normal range for platelets is 154 L and 54 x 10(9)L. Thrombocytopenia is a lower than normal number of platelets, less than 150,000 platelets per microliter in the blood. It can be inherited or acquired. The causes of thrombocytopenia can be classified into 3 groups. Question 101. The nurse is teaching a client about peptic ulcer disease. Which of the following statements should the nurse include? Here are the options. Option A. You should take aspirin if you have mild aches or pains. Option B. You will need to consume liquids 1 hour after each meal. Option C. It will be important to reduce the stress in your life. Option D. Take your prescribed omeprazole with food. The correct answer is option C. It will be important to reduce the stress in your life. Correct answer. It will be important to reduce the stress in your life. A client with peptic ulcer disease will need to reduce the amount of stress in their life to mitigate some of the symptoms. Ulcers can be caused by excessive use of non-steroidal anti-inflammatory drugs, alcoholism, and stress. Question 102. Which of the following are fine motor skills the nurse should expect a 5-month-old to have developed? Select all that apply. Choices: palmar grasp, bringing objects up to their mouth; pincer grasp, transferring objects from hand to hand; plays with fingers in midline. Here are the options. Option A, bringing objects up to their mouth, plays with fingers in midline, opens and shuts hands. The correct answer is option A, bringing objects up to their mouth, plays with fingers in midline, opens and shuts hands. Correct answer: bringing objects up to their mouth, plays with fingers in midline, opens and shuts hands. Plays with fingers in midline. Question 103. The nurse plans to use a mechanical lift to transfer a client from a stretcher to a wheelchair. Which appropriate action should the nurse take? Here are the options. Option A, keep the stretcher's side rails raised during the transfer. Option B, instruct the client to fold their arms over their chest. Option C, apply gloves and gown for this procedure. Option D, unlock the wheels on the stretcher and wheelchair. The correct answer is option B, instruct the client to fold their arms over their chest. Correct answer: instruct the client to fold their arms over their chest. During any mechanical lift transfer, the nurse should instruct the client to fold their arms over the chest, preventing injuries to the client's arms during the transfer. Question 104. The nurse is caring for a client who has just been diagnosed with severe acne vulgaris. Which of the following medications should the nurse anticipate the primary health care provider (PHCP) will prescribe? Here are the options. Option A, isotretinoin. Option B, acyclovir. Option C, ketoconazole. Option D, ethambutol. The correct answer is option A, isotretinoin. Correct answer: isotretinoin. Question 105. The licensed practical/vocational nurse LPN/VN is assisting the triage nurse. Which of the following clients in the emergency department ED triage requires the most rapid action to protect other clients in the ED from infection? Here are the options. Option A, a travel blogger who needs tuberculosis testing after exposure to a person with TB during his trip. Option B, an older woman who has a history of a methicillin-resistant Staphylococcus aureus marassae leg wound infection. Option C, a pregnant woman with a blister-like rash on the face that is possibly having varicella. Option D, an infant with a runny nose whose older brother has pertussis. The correct answer is option C, a pregnant woman with a blister-like rash on the face that is possibly having varicella. Correct answer: a pregnant woman with a blister-like rash on the face that is possibly having varicella. The primary responsibility of the triage nurse is to conduct an initial nursing assessment and determine which clients require immediate care or isolation. The triage nurse should be capable of identifying clients who may pose a potential risk to others by being familiar with commonly occurring illnesses and infections. Chickenpox varicella is transmitted through the air and can easily spread to other clients in the emergency unit. Varicella is highly contagious, and pregnant women are at risk of severe complications. It's crucial to promptly isolate and manage this client to prevent potential outbreaks and protect others in the ED from exposure to the virus. This client should be placed in a negative pressure room. Question 106. A pregnant client at 16 weeks gestation developed a pulmonary embolism and was initiated on intravenous heparin therapy 2 days ago. She is now getting discharged. The nurse has provided medication education and you are assigned to reinforce the medication teaching. Which of the following medications do you expect the physician to order at discharge? Choices: warfarin, apixaban, rivaroxaban, low molecular weight heparin, LMWH. Here are the options. Option A: low molecular weight heparin, LMWH. The correct answer is option A: low molecular weight heparin, LMWH. Correct answer: low molecular weight heparin, LMWH. The physician will most likely order to be self-administered twice daily. The dosing schedule and monitoring of LMWH are more convenient than that of unfractionated heparin and, therefore, does not cause fetal harm. LWMH and unfractionated heparin are the during pregnancy. LMWH will provide therapeutic anticoagulation for the rest of the pregnancy. Most venous thromboembolism events need therapeutic anticoagulation for at least 3 to 6 months. However, pregnancy is a hypercoagulable state. The client, therefore, is at risk for recurrent thromboembolism throughout her pregnancy and at least 6 weeks postpartum. Question 107. The licensed practical/vocational nurse LPN/VN reinforces teaching a client about newly prescribed isoniazid ANH for pulmonary tuberculosis. Which of the following statements by the client would require follow-up? Here are the options. Option A: I will have to take this medication for 3 months. Option B: I will need to have my blood drawn periodically to see if I am having an adverse effect to this medication. Option C: I will not be considered infectious if I have 3 consecutive negative sputum samples. Option D: this medication may make my hands and feet have numbness and tingling sensations. The correct answer is option A: I will have to take this medication for 3 months. Correct answer: I will have to take this medication for 3 months. This statement requires follow-up because it is not accurate. Antitubulin medications must be taken for 6 to 9 months to complete treatment and prevent resistance. If the client is at risk of poor treatment adherence, they may be ordered where an individual supervises the client to take their medication. Question 108. You are taking care of a 5-year-old girl on a pediatrics floor at the hospital. While engaging her in conversation, you note that she uses 4-5 words in complete sentences. She can tell you what color her stuffed animals are, and she tells you stories about what the stuffed animals have done today. Knowing the appropriate language development milestones, the nurse should do which of the following? Here are the options. Option A: consult the speech-language pathologist for evaluation. Option B: notify the healthcare provider. Option C: continue with the assessment. Option D: engage the child's mother with questions about how the child communicates at home. The correct answer is option C: continue with the assessment. Correct answer: continue with the assessment. The nurse should continue with her assessment. The nurse has observed several milestones of language development that are normal for a 5-year-old. She should take note of this and continue to assess the child. Other language development milestones that she would expect include a vocabulary of about 2,100 words, correctly naming objects and people, and knowing their own name and address. Question 109. The nurse is caring for a client with streptococcal pharyngitis tonsillitis who has been placed on droplet precautions. Which of the following statements indicates the best understanding of this type of isolation? Here are the options. Option A. The client can be placed in a room with another client with measles rubiola. Option B. A special mask N95 should be worn when working with the client. Option C. Must maintain a spatial distance of 3 feet. Option D. Gloves should be worn only when giving direct care. The correct answer is option C. Must maintain a spatial distance of 3 feet. Correct answer. Must maintain a spatial distance of 3 feet. A spatial distance of at least 3 feet is recommended. The most common forms of transmission of an organism in a client with tonsillitis are coughing, sneezing, and talking. Droplets can travel no more than 3 ft, so precautions should be maintained when there is a possibility of entering this distance. Question 110. The primary healthcare provider PHCP prescribes a regular insulin infusion for a client. The prescription is for 2 units/HR. The label on the medication reads 250 ml of 0.9% saline containing 100 units of regular insulin. How many ml/HR should the client receive? Choices. Next, take the amount of the medication and multiply it by the volume. The formula of dose ordered/dose on hand x volume will be utilized to solve this problem. 0.02 units x 250 ml equals. Here are the options. Option A. 5 ml/HR. The correct answer is option A. 5 ml/HR. Correct answer. 5 ml/HR. 2 units/100 units equals 0.02 units. Question 111. The nurse is caring for a client with end-stage renal disease who is receiving prescribed sevelamer. Which of the following findings would indicate a therapeutic response? Here are the options. Option A. Decreased serum calcium levels. Option B. Increased hemoglobin and hematocrit. Option C. Decreased serum potassium levels. Option D. Decreased serum phosphorus levels. The correct answer is option D. Decreased serum phosphorus levels. Correct answer. Decreased serum phosphorus levels. Sevelamer is a phosphate binder indicated in the treatment of hyperphosphatemia associated with chronic kidney disease. This medication is purported to decrease serum phosphorus levels by binding to food. Thus, this medication is given with meals. Combined with a low phosphorus diet, the goal of this medication is to decrease serum phosphate levels. Question 112. A nurse is preparing to administer gentamicin to a child. The order is for 3 mg/kg Roman 4 daily in 3 divided doses. The client weighs 97 pounds. How many milligrams should the nurse administer per dose? Fill in the blank. Round your answer to the nearest whole number. Choices. 97 pounds equals 44.1 kg. Next, determine the total daily dose for this child. Here are the options. Option A. 44 mg. The correct answer is option A. 44 mg. Correct answer. 44 mg. Question 113. A client has been marked as confidential due to safety concerns. Which of these actions would be for the nurse? Here are the options. Option A. Keep the client's name/information out of public areas such as the nurse's station. Option B. Tell the client's mother he is okay when she calls to ask if he is still on the unit. Option C. Deny that the client is on the unit when visitors come or call. Option D. Remove the client from confidential status when he asks to be removed. The correct answer is option B. Tell the client's mother he is okay when she calls to ask if he is still on the unit. Correct answer. Tell the client's mother he is okay when she calls to ask if he is still on the unit. When a client has asked to be flagged as confidential, no medical personnel can give out any information, including verifying the client's presence in the hospital. This option violates the principle of confidentiality. Question 1. In a 14, nurse is caring for a client with polycystic kidney disease (PKD). The nurse should prioritize which of these lab results to determine renal function in a client with a background of PKD. Here are the options. Option A. BUN 90 mg/dl both sexes, 10-20 mg/dl, 3.6 to 7.1 ml/L. Option B. Serum potassium 7.0 mg/L both sexes, 3.5-5 mg/L. Option C. Uric acid 7.5 3.4-7.0 mg/dl for men and 2.4-6.0 mg/dl for women. Option D. Creatinine 8.7 mg/dl male, 0.6-1.2 mg/dl female, 0.5-1.1 mg/dl male, 53-106 mmol/L, female: 44-97 mmol/L. The correct answer is option D. Creatinine 8.7 mg/dl male, 0.6-1.2 mg/dl female, 0.5-1.1 mg/dl male, 53-106 mmol/L, female: 44-97 mmol/L. Correct answer. Creatinine 8.7 mg/dl male, 0.6-1.2 mg/dl female, 0.5-1.1 mg/dl male, 53-106 mmol/L, female: 44-97 mmol/L. Creatinine is a specific indicator of renal function/failure. Polycystic kidney disease (PKD) is a genetic disorder that causes fluid-filled cysts to grow inside the kidneys. Unlike simple kidney cysts that may develop later in life, PKD cysts can change the shape of organs and alter their function. Several tests can evaluate renal functioning. A creatinine level of 8.7 mg/dl is significantly higher than the normal reference range for both sexes. Creatinine is a waste product that is filtered by the kidneys, and elevated levels indicate reduced kidney function and impaired glomerular filtration rate (GFR). This result is a strong indicator of kidney dysfunction in the context of PKD. Question 115. The nurse is caring for a client with Cushing's disease. The client asks for assistance in choosing dinner. Which meal is the best option? Here are the options. Option A. Hamburger with French fries and apple slices. Option B. Pork chops and cream sauce with mashed potatoes and carrots. Option C. Roasted chicken with corn and green beans. Option D. Mexican-style beef with guacamole and beans on the side. The correct answer is option C. Roasted chicken with corn and green beans. Correct answer. Roasted chicken with corn and green beans. A client with Cushing's disease needs to eat a low-sodium, high-protein, and low-fat diet. Roasted chicken is high in protein with low in fat. Cushing's disease is a serious condition of an excess of the steroid hormone cortisol in the blood level caused by a pituitary tumor secreting adrenocorticotropic hormone ACTH. Since cortisol is essential for metabolic processes, Hypercortisolism associated with Cushing's can significantly affect how the body processes nutrients. Clients with Cushing's disease are encouraged to reduce sodium intake to reduce the risk of hypertension and weight gain. Increased calcium and vitamin D. Cushing's disease can cause reduced bone density and osteoporosis. Question 116. The nurse is caring for a client who is receiving prescribed acamprosate. Which of the following statements, if made by the client, would indicate a therapeutic response? Here are the options. Option A. I no longer hear voices. Option B. I have more motivation during the day. Option C. I am not drinking alcohol anymore. Option D. My anxiety has lessened in public. The correct answer is option C. I am not drinking alcohol anymore. Correct answer. I am not drinking alcohol anymore. Acamprosate is a medication intended to treat alcohol use disorder. This medication may be combined with naltrexone to increase the chance of sobriety. Question 117. The nurse is preparing to admit a client following lumbar spinal fusion surgery. The nurse should instruct the unlicensed assistive personnel UAP to have which equipment at the bedside? Here are the options. Option A. Overhead trapeze. Option B. Abduction pillow. Option C. Transfer board. Option D. Continuous passive motion CPM. The correct answer is option C. Transfer board. Correct answer. Transfer board. Following a lumbar spinal fusion, the client will need to be log-rolled. A transfer board/sheet, along with an ample amount of staff, at least 3, will be necessary to facilitate the log roll. Question 118. You are called to assess a 4-year-old client who has suffered 2nd and 3rd-degree burns to her chest, abdomen, and legs. It is estimated that about 40% of her total body surface area TBSA is burned. Upon assessment, her vital signs are as follows. Here are the options. Option B. Intubation and mechanical ventilation. The correct answer is option B. Intubation and mechanical ventilation. Correct answer. Intubation and mechanical ventilation. Intubation and mechanical ventilation are the priority for this client. Intubation is the A in your ABC's airway. The stem of the question states that this client has burns to her chest. You know that smoke inhalation can burn the trachea and compromise the airway, and wounds to the chest are an indication that inhalation injury has likely occurred. Question 119. The nurse is caring for a client who is receiving prescribed doxorubicin. Which of the following findings would indicate the client is having an adverse effect? Here are the options. Option A. Urine discoloration. Option B. Pulmonary congestion. Option C. Hirsutism. Option D. Pruritus. The correct answer is option B. Pulmonary congestion. Correct answer. Pulmonary congestion. Doxorubicin is an antineoplastic that is indicated for a variety of cancers. Doxorubicin is highly cardiotoxic, which may cause cardiomyopathy. The cardiotoxicity may cause a decrease in left ventricular ejection fraction, therefore causing pulmonary congestion and, at worst, life-threatening pulmonary edema. The client may present with leg edema, cough, and worsening shortness of breath. Question 120. The nurse is counseling a client with opioid use disorder. The nurse understands that treatment choices for opioid use disorder include which of the following? Select all that apply. Choices: selagelene, naltrexone, methadone, buprenorphine, bupropion. Here are the options. Option A: naltrexone, methadone, buprenorphine. The correct answer is option A: naltrexone, methadone, buprenorphine. Correct answer: naltrexone, methadone, buprenorphine. Bupropion. Question 121. The nurse is preparing to administer penicillin V potassium to a child with pneumonia. The child weighs 18.5 kg. The prescription is for 50 mg/kg/day PO divided doses every 6 hours. How many milligrams should the child receive with each dose? Round your answer to the nearest whole number. Fill in the blank. Choices: 50 mg x 18.5 equals 925 mg. Next, determine the individual dose. The drug is given every 6 hours, so the child will receive. Here are the options. Option A: 231 mg. The correct answer is option A: 231 mg. Correct answer: 231 mg. 925 mg day 4 doses day equals 231.25. Question 122. NGN the nurse cares for a client in the outpatient surgical center who is scheduled for a cholecystectomy. Item 1 of 1 choices. Medications, demographics. Here are the options. Option A: the surgeon has not obtained informed consent. The client stated he was going to drive himself home after the procedure. The correct answer is option A: the surgeon has not obtained informed consent. The client stated he was going to drive himself home after the procedure. Correct answer: the surgeon has not obtained informed consent. The client stated he was going to drive himself home after the procedure. Assessment items requiring follow-up include the by the surgeon. Before further preoperative activities may continue, the nurse must ensure this is completed to avoid unnecessary diagnostic testing and intervention. Additionally, the client after this procedure, because this involves general anesthesia. Activities requiring significant concentration, operation of heavy machinery, or driving are typically prohibited 24 hours following the initiation of general anesthesia. Question 123. The nurse is observing unlicensed assistive personnel UAP care for assigned clients. Which of the following actions by the UAP would require the nurse to intervene? Select all that apply. Choices: flexes and extends the patient's elbow for an active range of motion. Obtains orthostatic blood pressure by having the patient stand first. Places the cane on the unaffected side of a patient who had a stroke. Provides a hot foot soak for a patient with diabetes mellitus. Here are the options. Option A: flexes and extends the patient's elbow for an active range of motion. Obtains orthostatic blood pressure by having the patient stand first. Provides a hot foot soak for a patient with diabetes mellitus. The correct answer is option A: flexes and extends the patient's elbow for an active range of motion. Obtains orthostatic blood pressure by having the patient stand first. Provides a hot foot soak for a patient with diabetes mellitus. Correct answer: flexes and extends the patient's elbow for an active range of motion. Obtains orthostatic blood pressure by having the patient stand first. Provides a hot foot soak for a patient with diabetes mellitus. Question 124. The LPN is assisting the nurse in caring for a client who is receiving a continuous opioid infusion. The LPN should understand which of the following, if detected, is a concerning finding. Here are the options. Option A. The client has a respiratory rate of 10 breaths/min with normal depth. Option B. The client's sedation level is 4. Option C. The client experiences mild confusion. Option D. The client reports constipation. The correct answer is option B. The client's sedation level is 4. Correct answer. The client's sedation level is 4. Sedation level is more indicative of respiratory depression because a drop in level usually precedes respiratory depression. A sedation level of 4 calls for immediate action because the client has minimal or no response to stimuli. Question 125. The nurse is discussing infection control with a group of nursing students. Which indication would be appropriate for the nurse to use an alcohol-based sanitizer? Select all that apply. Choices: immediately before touching a client if the hands are visibly soiled with blood or bodily fluids when changing linens for a client infected with Clostridium difficile after changing a diaper for an infant infected with norovirus before moving from work on a soiled body site to a clean body site on the same client. Here are the options. Option A. Immediately before touching a client. Before moving from work on a soiled body site to a clean body site on the same client. The correct answer is option A. Immediately before touching a client. Before moving from work on a soiled body site to a clean body site on the same client. Correct answer. Immediately before touching a client. Before moving from work on a soiled body site to a clean body site on the same client. Alcohol-based hand rubs (ABAs) are recommended over hand hygiene with soap and water because of the risk of errors associated with washing hands with soap and water have been established for when a healthcare worker should use an ABA, and these two circumstances are appropriate. Question 126. The LPN is training a new nurse on the medical surgical floor. Which action would warrant intervention by the experienced LPN? Here are the options. Option A. The nurse administers oral cefdinir 30 minutes early. Option B. The nurse places a surgical mask on a patient with influenza before transport. Option C. The nurse obtains green drainage from a nasogastric tube for culture. Option D. The nurse secures a Jackson Pratt drain to the patient's gown with a safety pin. The correct answer is option C. The nurse obtains green drainage from a nasogastric tube for culture. Correct answer. The nurse obtains green drainage from a nasogastric tube for culture. Nasogastric tubes drain gastric contents, which are typically yellow/green in color due to the presence of bile. Sending it for cultures may cause unnecessary worry for the patient and would be inappropriate, since this is an expected assessment. All other actions listed are appropriate. Question 127. Which of the following statements accurately describes behaviors that place juveniles at increased risk for injury? Select all that apply. Choices: approximately 5,000 individuals under the age of 21 die from alcohol-related accidents annually. 1 in 3 high school students report using some type of tobacco product. The CDC lists motor vehicle accidents as the #1 cause of death among adolescents. The use of OTC and prescription drugs among teens is at an all-time high. Here are the options. Option A. Approximately 5,000 individuals under the age of 21 die from alcohol-related accidents annually. The CDC lists motor vehicle accidents as the #1 cause of death among adolescents. The use of OTC and prescription drugs among teens is at an all-time high. The correct answer is option A. Approximately 5,000 individuals under the age of 21 die from alcohol-related accidents annually. The CDC lists motor vehicle accidents as the #1 cause of death among adolescents. The use of OTC and prescription drugs among teens is at an all-time high. Correct answer. Approximately 5,000 individuals under the age of 21 die from alcohol-related accidents annually. The CDC lists motor vehicle accidents as the #1 cause of death among adolescents. The use of OTC and prescription drugs among teens is at an all-time high. Question 128. The licensed practical/vocational nurse LPN/VN is assisting a registered nurse in triaging a client with diabetes mellitus type 1 with diabetic ketoacidosis DKA. Which assessment finding requires immediate follow-up by the LPN/VN? Here are the options. Option A, pulse 112/minute. Option B, persistent nausea and vomiting. Option C, respiratory rate 21/minute. Option D, blood glucose 299 mg/dl. The correct answer is option A, pulse 112/minute. Correct answer, pulse 112/minute. A complication associated with DKA is hypovolemic shock. The client having tachycardia is demonstrating early signs of this type of shock. The treatment modalities of DKA include fluid repletion and insulin administration. Considering the client's tachycardia, the nurse should initially administer the prescribed isotonic fluids to treat the significant fluid volume deficit. Question 129. The nurse reinforces teaching to parents planning to tell their children about their divorce. To promote effective coping by the children, the nurse should teach the parents to do which of the following? Select all that apply. Choices. Do not avoid telling the children about the divorce. Provide physical and emotional reassurance to the children. Try not to cry in front of the children. Limit the amount of time discussing the divorce. Children feeling anger or resentment is expected. Here are the options. Option A. Do not avoid telling the children about the divorce. Provide physical and emotional reassurance to the children. Children feeling anger or resentment is expected. The correct answer is option A. Do not avoid telling the children about the divorce. Provide physical and emotional reassurance to the children. Children feeling anger or resentment is expected. Correct answer. Do not avoid telling the children about the divorce. Provide physical and emotional reassurance to the children. Children feeling anger or resentment is expected. Question 130. The nurse is caring for a client with Buerger's disease. The nurse plans on suggesting that the client receive a referral for. Here are the options. Option A, occupational therapy. Option B, speech therapy. Option C, smoking cessation. Option D, group psychotherapy. The correct answer is option C, smoking cessation. Correct answer, smoking cessation. Arterial and venous blood flow impediments characterize Buerger's disease. This impediment is caused by inflammation and is significantly worsened by smoking. The nicotine causes vasoconstriction and worsens blood flow. A critical intervention for a client with this condition is discussing smoking cessation with this client. Question 131. When assessing a client who has been ordered skeletal traction, the assessment reveals her foot is pale, cool, and her pulse is not palpable. What is the priority nursing intervention? Choices. Reassess the foot in 20 minutes. Administer the ordered as needed medication. Readjust the traction. Notify the physician. Here are the options. Option A. Notify the physician. The correct answer is option A. Notify the physician. Correct answer. Notify the physician. The symptoms indicate circulatory impairment. The physician or practitioner must be notified immediately. Question 132. The nurse is caring for a client on a continuous telemetry monitor and observes a prolonged PR interval, widened QRS complex, and a tall T wave. Which electrolyte abnormality does the nurse suspect? Here are the options. Option A. Hypermagnesemia. Option B. Hypomagnesemia. Option C. Hyperphosphatemia. Option D. Hypochloremia. The correct answer is option A. Hypermagnesemia. Correct answer. Hypermagnesemia. Hypermagnesemia is a dangerous electrolyte abnormality that can cause many EKG changes in severe cases. A prolonged PR interval, widened QRS complex, and a tall T wave are characteristics of hypermagnesemia. Question 133. The nurse is caring for a client who has influenza. Which of the following prescriptions may be prescribed by the primary healthcare provider PHCP? Here are the options. Option A. Valacyclovir. Option B. Oseltamivir. Option C. Azithromycin. Option D. Omeprazole. The correct answer is option B. Oseltamivir. Correct answer. Oseltamivir. Oseltamivir is an antiviral agent approved for the treatment of influenza. This medication should be initiated within 48 hours of symptom onset. Question 134. The client received 0.45% saline at 85 ml/HR. Fill in the blank. Choices: 1 8-ounce cup of coffee, 3 8-ounce cups of water, 1 8-ounce cup of ice chips, 120 ml, 1 8-ounce cup of ice cream. Here are the options. Option A. 2,340 ml. The correct answer is option A. 2,340 ml. Correct answer. 2,340 ml. The nurse is calculating the 12-hour intake for a client. Question 135. The LPN enters her 5-year-old patient's room and finds him lying on the floor. His fall was unwitnessed. What is her priority nursing action? Here are the options. Option A. File an incident report. Option B. Assist the child back to bed. Option C. Call for help. Option D. Assess the child for any injuries. The correct answer is option D. Assess the child for any injuries. Correct answer. Assess the child for any injuries. The priority nursing action is to, before doing anything else, the nurse needs to know if the child was injured during the fall. This will determine what her next steps are. Question 136. What question would be most important to ask a male client who is in for a digital rectal examination? Here are the options. Option A. Have you noticed a change in the force of urine when you empty your bladder? Option B. Have you noticed a change in tolerance of certain foods in your diet? Option C. Do you notice polyuria in the AM? Option D. Do you notice any burning with urination or any odor to the urine? The correct answer is option A. Have you noticed a change in the force of urine when you empty your bladder? Correct answer. Have you noticed a change in the force of urine when you empty your bladder? A change in the urinary stream force could indicate a complication associated with BPH, benign prostatic hypertrophy. Question 137. Which of these would be an appropriate assignment for the LPN/LVN? Here are the options. Option A. A 17-year-old client with a femur fracture that is just returning to the floor from the recovery unit. Option B. A 21-year-old client with cystic fibrosis that needs an early morning sputum sample collection. Option C. An 82-year-old client 2 days post-op after knee replacement surgery who needs help ambulating. Option D. A 31-year-old client who is suffering from an acute asthma attack. The correct answer is option B. A 21-year-old client with cystic fibrosis that needs an early morning sputum sample collection. Correct answer. A 21-year-old client with cystic fibrosis that needs an early morning sputum sample collection. Collecting sputum samples on stable clients are within the scope of practice for an LPN/LVN. While an LPN/LVN may feel comfortable providing care for clients with varying degrees of illness, that does not mean that all attention should be delegated to an LPN/LVN. As an LPN/LVN, it is your responsibility to know which clients you should and should not care for and why. This is important because if an LPN/LVN accepts an assignment that is not within their scope of practice/competency, it could result in legal ramifications. Question 138. The nurse is assessing a client diagnosed with stage Roman 4 nephroblastoma. Which of the following actions is contraindicated in this client? Here are the options. Option A. Checking capillary refill. Option B. Auscultating heart sounds. Option C. Abdominal palpation. Option D. Assessing urine color. The correct answer is option C. Abdominal palpation. Correct answer. Abdominal palpation. Abdominal palpation is contraindicated in the client with a nephroblastoma. This is because the tumor is located in the abdominal cavity, and by palpating it, you can disturb the tissue and cause cells from the tumor to break loose and spread to other parts of the body. The nurse should not perform abdominal palpation on a client with a nephroblastoma. Question 139. The LPN is reinforcing teaching to students about the causes of hypokalemia. Which of the following conditions should the nurse identify as being a cause of this electrolyte imbalance? Select all that apply. Choices: diabetic ketoacidosis, metabolic alkalosis, Cushing's syndrome, Addison's disease, chronic renal failure. Here are the options. Option A. Metabolic alkalosis. Cushing's syndrome. The correct answer is option A. Metabolic alkalosis. Cushing's syndrome. Correct answer. Metabolic alkalosis. Cushing's syndrome. Chronic renal failure. Question 140. The client with tuberculosis is now on isoniazid. Which laboratory test should be monitored at least monthly? Here are the options. Option A. Patient and PTT. Option B. CBC. Option C. BUN. Option D. Liver enzymes. The correct answer is option D. Liver enzymes. Correct answer. Liver enzymes. Although it is rare, liver toxicity is a severe adverse effect of isoniazid. Healthcare providers should monitor for signs of jaundice, fatigue, elevated liver enzymes, and loss of appetite. Liver enzyme tests are usually performed monthly during therapy to identify early hepatotoxicity. Isoniazid is bactericidal for actively growing organisms and bacteriostatic for dormant mycobacteria. It is selective for M. tuberculosis. Isoniazid is used alone for chemoprophylaxis or in combination with other antitubercular drugs when treating active disease. Question 141. The nurse is planning a staff development conference about bioterrorism. Which of the following information should the nurse include? Select all that apply. Choices: Ebola virus disease (EVD) requires contact and droplet precautions. Early treatment with prescribed ciprofloxacin is essential in inhalation anthrax. A client with inhalation anthrax should be assigned to a room with monitored negative air pressure. The plague is spread by infected bird droppings. The plague produces a bull's-eye rash at the site of infection. Here are the options. Option A: Ebola virus disease (EVD) requires contact and droplet precautions. Early treatment with prescribed ciprofloxacin is essential in inhalation anthrax. The correct answer is option A. Ebola virus disease (EVD) requires contact and droplet precautions. Early treatment with prescribed ciprofloxacin is essential in inhalation anthrax. Correct answer: Ebola virus disease (EVD) requires contact and droplet precautions. Early treatment with prescribed ciprofloxacin is essential in inhalation anthrax. Ebola virus disease (EVD) can be fatal if not treated. The transmission of EVD includes person-to-person, primarily through unprotected contact with blood and body fluids. Additionally, the nurse should institute while wearing a face shield to prevent splashing of infected body fluids. Inhalation anthrax spread from person to person and is treated with aggressive dosing of antibiotics such as levofloxacin, ciprofloxacin, or doxycycline. Question 142. The nurse receives a prescription for sevelamer. The nurse plans on administering this medication. Here are the options. Option A: with the client's meals. Option B: immediately before hemodialysis. Option C: with the prescribed proton pump inhibitor PPI. Option D: right before the client goes to bed. The correct answer is option A: with the client's meals. Correct answer: with the client's meals. Sevelamer is a phosphate binder indicated in the treatment of hyperphosphatemia associated with chronic kidney disease. This medication is purported to decrease serum phosphorus levels by binding to food. Thus, this medication is given with meals. Combined with a low phosphorus diet, the goal of this medication is to decrease serum phosphate levels. Question 143. The primary healthcare provider PHCP prescribes azithromycin 500 mg daily for a client with sepsis. The medication label reads 500 mg of azithromycin mixed in 250 ml of 0.9% saline. The drop factor is 15 gTTS/ml, and it is to be infused over 60 minutes. The nurse sets the flow rate at how many drops per minute? Round your answer to the nearest whole number. Fill in the blank. Here are the options. Option A: 63 gTTS. The correct answer is option A: 63 gTTS. Correct answer: 63 gTTS. 250 ml x 15 gTT equals 3,750 ml. Question 144. The licensed practical/vocational LPN/VN nurse collects data on a client with Huntington's disease. Which of the following findings would be expected? Select all that apply. Choices: halitosis, hallucinations, hematemesis, weight loss, chorea. Here are the options. Option A: chorea, hallucinations, weight loss. The correct answer is option A: chorea, hallucinations, weight loss. Correct answer, chorea. Hallucinations, weight loss. Question 145. Increased levels of which of the following hormones is related to hyperemesis gravidarum? Here are the options. Option A, testosterone. Option B, progesterone. Option C, aldosterone. Option D, estrogen. The correct answer is option D, estrogen. Correct answer, estrogen. The cause of hyperemesis is related to high estrogen and human chorionic gonadotropin HCG levels. Nausea and vomiting, also known as morning sickness, are common during the first trimester of pregnancy for many women. If nausea and vomiting interfere with an inadequate intake of fluid/food and persists past 20 weeks of gestation, it is termed hyperemesis gravidarum. The cause is unknown, but elevated hormone levels and the relaxation of smooth muscles result in delayed gastric emptying, which is believed to contribute to this condition. Hyperemesis can cause problems for the mother and fetus. Severe hyperemesis gravidarum can result in preterm labor. The dehydration that occurs may lead to reduced placental perfusion and inadequate oxygenation to the fetus. Fetal growth can be compromised, leading to an infant who is small for gestational age. Women with hyperemesis gravidarum in the second trimester have an increased risk for preterm labor, preeclampsia, i.e., an increase in blood pressure, protein in the urine, and edema, and placental abruption. Question 146. The nurse is reinforcing education to parents of a child who plans on riding their bicycle. Which statements, if made by the parents, indicate effective understanding? Here are the options. Option A, I should tell my child to ride against the traffic pattern. Option B, I should instruct my child to walk their bike through busy intersections. Option C, wearing a helmet is only necessary when my child is riding near a busy intersection. Option D, my child can ride their bike barefoot as long as it's short distances. The correct answer is option B. I should instruct my child to walk their bike through busy intersections. Correct answer. I should instruct my child to walk their bike through busy intersections. This statement indicates effective understanding. Parents should teach their child to dismount and walk their bike when crossing busy intersections. Walking the bike ensures better visibility and safety, reducing the risk of being hit by an automobile. Question 147. Which of the following medications is contraindicated for a pregnant client? Select all that apply. Choices: warfarin, finasteride, celecoxib, clonidine, transdermal nicotine. Here are the options. Option A, warfarin, finasteride. The correct answer is option A, warfarin, finasteride. Correct answer, warfarin, finasteride. Warfarin Coumadin has a pregnancy category X. It is associated with central nervous system defects, spontaneous abortion, stillbirth, prematurity, illness, and ocular defects at any time during pregnancy and fetal warfarin syndrome when given during the first trimester choice. Finasteride also has a pregnancy category X, which has a high risk of causing permanent damage to the fetus choice B. Question 148. The nurse is caring for assigned clients. The nurse should. Here are the options. Option A, administer prescribed antibiotics to a client with bacterial meningitis. Option B, reposition a client with chronic back pain who reports pain rated 6/10 on the numerical rating scale. Option C, remove a nitroglycerin transdermal patch for a client with chronic angina. Option D. Collect data on a client who had a coronary artery bypass grafting CABG 3 days ago and has a serum glucose of 135 mg/dL 70-110 mg/d. The correct answer is option A. Administer prescribed antibiotics to a client with bacterial meningitis. Correct answer. Administer prescribed antibiotics to a client with bacterial meningitis. Bacterial meningitis has a high mortality rate and requires aggressive and prompt antibiotic treatment. The nurse should prioritize this client because this is a serious, acute concern that may result in death. Prescribed ceftriaxone and vancomycin are the preferred antibiotics in treating this pathogen. Question 149. The nurse is caring for a client diagnosed with diabetes mellitus type I. Which of the following teaching points is most important for the nurse to reinforce? Here are the options. Option A. Check a hemoglobin A1C level every 3 months. Option B. Rotate injection sites for insulin administration. Option C. Examine their feet with a mirror daily. Option D. Recognize the symptoms of hypoglycemia. The correct answer is option D. Recognize the symptoms of hypoglycemia. Correct answer. Recognize the symptoms of hypoglycemia. This is the most important for the nurse to reinforce because hypoglycemia may cause significant harm. Signs and symptoms of hypoglycemia include palpitations, tachycardia, cool and clammy skin, lethargy, and coma. Question 150. The LPN is reinforcing discharge instructions to the parents of a 6-year-old girl with chickenpox. The LPN knows that the parents understand when they make which of the following statements. Here are the options. Option A. Once she has been without a fever for a day, she can go back to school. Option B. She will still be infectious for 14 days, so we should let the school know she will be out for 2 weeks. Option C. After antibiotics have been started, she can go back to school in 48 hours. Option D. Once all of her sores are crusted over, it will be safe for her to go back to school. The correct answer is option D. Once all of her sores are crusted over, it will be safe for her to go back to school. Correct answer. Once all of her sores are crusted over, it will be safe for her to go back to school. This statement demonstrates understanding by the parents. Chickenpox or varicella is considered infectious until all of the lesions have crusted over. For most children, this occurs 6-7 days after the last of the rash presence, but can take up to 10 days. Question 151. While teaching a new graduate nurse about the psychosocial development of your 2-year-old client, you educate her that your client is in which stage of development according to Erikson's stages of psychosocial development. Here are the options. Option A. Initiative versus guilt. Option B. Autonomy versus shame and doubt. Option C. Industry versus inferiority. Option D. Trust versus mistrust. The correct answer is option B. Autonomy versus shame and doubt. Correct answer. Autonomy versus shame and doubt. Autonomy versus shame and doubt is the typical development stage for early childhood, which lasts from ages 2 to 3 years, so this is what the nurse would expect for her 2-year-old client. In autonomy versus shame and doubt, children seek to develop a sense of personal control over physical skills and a sense of independence. When they are successful, for example, with a task like toilet training, they feel independent, leading to a sense of autonomy. When they are not successful, they feel they are a failure, resulting in shame and self-doubt. Question 152. A nurse has attended a continuing education conference about seasonal influenza. Which of the following statements would indicate a correct understanding of the conference? Here are the options. Option A. Oseltamivir therapy should be started 96 hours after the onset of symptoms. Option B. The live attenuated vaccine LAV is for healthy non-pregnant individuals 2 through 49 years old. Option C. Individuals who are pregnant should not receive the inactivated influenza vaccine. Option D. Visitors should be provided face shields when entering a client's room. The correct answer is option B. The live attenuated vaccine LAV is for healthy non-pregnant individuals 2 through 49 years old. Correct answer. The live attenuated vaccine LAV is for healthy non-pregnant individuals 2 through 49 years old. This statement is correct. The LAV is a nasal spray flu vaccine approved for use in healthy non-pregnant people 2 through 49 years old. Individuals who are pregnant, immunocompromised, younger than 2, or older than 49 should not receive this vaccine. The LAV contains weakened influenza viruses that are cold-adapted, which means they are designed to only multiply at the cooler temperatures found within the nose and not the lungs or other areas where warmer temperatures exist. No influenza vaccine causes influenza. The LAV has demonstrated a more robust immune response when compared to the IIV. Question 153. The nurse is caring for a client who recently had a partial gastrectomy. Which of the following medications should the nurse anticipate that the primary healthcare provider PHCP will order? Choices: vitamin B12, sucralfate hydroxyzine metoclopramide. Here are the options. Option A. Vitamin B12. The correct answer is option A. Vitamin B12. Correct answer, vitamin B12. Procedures like a gastrectomy put the client at risk for pernicious anemia B12 deficiency. It is quite common for a client to receive parenteral B12 replacement indefinitely. Question 154. The primary healthcare provider PHCP prescribes dopamine at 5 mcg/kg/minute. The client weighs 178 pounds. The medication label reads dopamine 800 mg in 500 ml of dextrose 5% water D5W. How many ml per hour will be administered to the client? Fill in the blank. Round your answer to the nearest whole number. Here are the options. Option A. 5 mcg x 80.9 kg x 60 minutes equals 24,270 mcg. The correct answer is option A. 5 mcg x 80.9 kg x 60 minutes equals 24,270 mcg. Correct answer. 5 mcg x 80.9 kg x 60 minutes equals 24,270 mcg. 5 mcg x 80.9 kg x 60 minutes equals 24,270 mcg. Question 155. NGN*. The nurse is caring for a client with a pneumothorax who has a wet suction chest tube. Item 1 of 1 choices. Pain at the insertion site for each assessment finding. Click to specify if it is expected or requires follow-up chest tube at 20 cm with wall suction. Here are the options. Option A. Expected. The correct answer is option A. Expected. Correct answer. Expected. Findings requiring follow-up include: Question 156. The nurse is supervising a student nurse administer prescribed medications via a double-lumen nasogastric tube NGT with an air vent. Which action by the student requires follow-up? The student. Here are the options. Option A. Irrigates the air vent before medication administration with water. Option B. Contacts the pharmacy to obtain available medications in liquid form. Option C. Flushes the NGT between medications with water. Option D. Administers each medication separately through the NGT. The correct answer is option A. Irrigates the air vent before medication administration with water. Correct answer. Irrigates the air vent before medication administration with water. The air vent should not be irrigated with water or used to administer medications. The purpose of the air vent is to permit free, continuous drainage of secretions when the NGT is connected to suction. This vent is found on a Salem sump tube and is often called a blue pigtail. Question 157. The nurse is reinforcing teaching with a client who is scheduled for a contraction stress test CST. Which of the following statements should the nurse include? Here are the options. Option A. You will need to consume a liquid with 50 grams of glucose. Option B. You may need to stimulate your nipples during this test. Option C. A positive result means your baby has had no late decelerations. Option D. A negative result means your baby has had variable decelerations. The correct answer is option B. You may need to stimulate your nipples during this test. Correct answer. You may need to stimulate your nipples during this test. A CST is indicated for clients who are high risk and are in the third trimester. It requires the client to have contractions either through oxytocin administration or nipple stimulation. Question 158. George, age 8, is admitted with rheumatic fever. Which clinical finding indicates to the nurse that George needs to continue taking the salicylates he had received at home? Here are the options. Option A. Chorea. Option B. Polyarthritis. Option C. Subcutaneous nodules. Option D. Erythema marginatum. The correct answer is option B. Polyarthritis. Correct answer. Polyarthritis. Polyarthritis is characterized by swollen, painful, hot joints that respond to salicylates. Rheumatic fever is an inflammatory disease that can develop when strep throat or scarlet fever, caused by Streptococcus bacteria, isn't adequately treated. It most often affects children between 5 and 15 years old, though it can develop in younger children and adults. Although strep throat is frequent, rheumatic fever is rare in the United States and other developed countries. However, rheumatic fever remains common in many developing nations. Rheumatic fever can cause permanent damage to the heart, including damaged heart valves and heart failure. Treatments can reduce inflammation, lessen pain and other symptoms, and prevent the recurrence of rheumatic fever. Question 159. The nurse performs data collection on an older adult client and observes apnea alternates with periods of rapid breathing. The nurse should document this respiratory pattern as. Here are the options. Option A. Cheyne-Stokes. Option B. Kussmaul's. Option C. Agonal. Option D. Tachypnea. The correct answer is option A. Cheyne-Stokes. Correct answer. Cheyne-Stokes. Cheyne-Stokes respirations are characterized when the respiratory rate and depth are irregular and alternate with periods of apnea and hyperventilation. The pattern then reverses and the breathing slows and becomes shallow, concluding as apnea before respiration resumes. This may occur in older adults without any underlying pathology. This also could be characteristic of the client's critical condition following a neurological injury. Question 160. The nurse is reviewing leadership and management concepts with a student nurse. It would require further teaching if the student nurse made which of the following statements? Here are the options. Option A. The laissez-faire leadership style is a passive leadership approach. Option B. A registered nurse RN may delegate accountability to a licensed practical nurse LPN. Option C. The rights of delegation include task, circumstance, person, direction, supervision. Option D. The State Nurse Practice Act defines roles and responsibilities of nursing professionals. The correct answer is option B. A registered nurse RN may delegate accountability to a licensed practical nurse LPN. Correct answer. A registered nurse RN may delegate accountability to a licensed practical nurse LPN. An RN may delegate specific responsibilities to an LPN but cannot delegate accountability. The RN retains accountability when delegating client assignments and tasks, but maintains accountability. Question 161. The nurse is caring for a 70-year-old client in a clinic who has complaints of perineal irritation due to frequent incontinence. Which of the following measures suggested to the client by the nurse are? Select all that apply. Choices. Use extra-large briefs to provide for air movement. Apply a generous amount of barrier cream. Gently cleanse the perineum 2 to 3 times per day with warm water and pat dry. Apply bacitracin cream to the perineum. Here are the options. Option A. Apply a generous amount of barrier cream. Gently cleanse the perineum 2 to 3 times per day with warm water and pat dry. The correct answer is option A. Apply a generous amount of barrier cream. Gently cleanse the perineum 2 to 3 times per day with warm water and pat dry. Correct answer. Apply a generous amount of barrier cream. Gently cleanse the perineum 2 to 3 times per day with warm water and pat dry. Barrier cream is appropriate for preventing and managing perineal irritation because it creates a protective layer on the skin, helping to prevent contact with irritants such as urine and feces. This can reduce the risk of skin breakdown and discomfort. Proper perineal hygiene is crucial for maintaining skin integrity and preventing irritation in individuals with incontinence. Regular cleansing with warm water helps remove irritants and bacteria while patting the area dry minimizes friction and moisture, both of which can contribute to skin irritation. Question 162. The emergency department ED nurse cares for a client receiving prescribed warfarin and reports dizziness, black tarry stools, and bloody gums. The international normalized ratio INR returns at 5. The nurse anticipates the primary healthcare provider PHCP will prescribe which blood product? Here are the options. Option A. Packed red blood cells PRBCS. Option B. Platelets. Option C. Granulocytes. Option D. Fresh frozen plasma FFP. The correct answer is option D. Fresh frozen plasma FFP. Correct answer. Fresh frozen plasma FFP. FFP would be prescribed because this client is experiencing bleeding related to the prescribed warfarin. The client's INR is grossly elevated. Therapeutic for VTE prophylaxis is 2-3, and FFP includes the vitamin K-dependent clotting factors Roman 2, Roman 7, Roman 9, X, protein C, and S that need to be replaced to stop the bleeding. Vitamin K may be prescribed, but the efficacy takes 6 to 8 hours. FFP can treat the bleeding almost immediately.